Good morning, everyone. Can you hear me? Okay, good. Okay, so today's March 1st. We're going to start our board meeting here. And I'd like to call to order and adjust a quorum, establish a quorum. But before we do that, actually, I'd like to introduce our newest member to the board, which is Dr. McAloon. We're really happy that she's here. She comes with a lot of experience from many parts of podiatric medicine. She's a degree from the California College of Podiatric Medicine, and she also completed both her primary podiatric medicine and surgical residencies at the VA Palo Alto. She's board certified as a podiatric physician and surgeon. She's the past president of the California Podiatric Medical Association and a member of the American Podiatric Medical Association and the Alameda Contra Podiatric Medical Society. She's a fellow of the American College of Foot and Ankle Surgeons and a diplomat of the American Board of Foot and Ankle Surgery. And she's also the co-owner of a private practice, Bay Area Foot Care. And it is wonderful that we successfully got an appointment to the board. So welcome and thank you. Okay, so with our
Let's go ahead and get a roll call.
Yes. So now we're going to go ahead and get a roll call. So Kathleen?
Dr. Judith Manzi.
Present.
Darlene Trulio-Elliott.
Present.
Maria Cadenas.
Present.
Christina Dixon.
Present.
Dr. Carolyn McAloon.
Present.
Dr. Neil Mansdorf.
Present.
Dr. Michael Zack.
Present.
Thank you.
Okay. So next, the board may not discuss or take action on any matters raised during this public comment section, except to decide whether to place the matter on the agenda for future meetings. And I'd like to remind everyone of that. And so with that, I'd like to have a review and approve our December 7th board meeting minutes. Have everyone looked at them, and do I have a motion to approve?
You have a motion?
And do I have a second to that motion?
Zaff, second.
Who's the first one?
Dr. Darlene Elliott. Great. Okay, so now I would like to invite Ryan Spencer.
Let's rewind a little bit and
Okay.
have, if there's any members of the public that would like to comment on anything, please feel free to do so now. Okay. We're
Okay,
good.
great. All right, so I'd like an update now from California Podiatric Medical Association.
And then we have one more
Okay.
on the minutes. I think we need to adjust and scratch off Ms. Cooper and put Kathleen Cooper because there's not a list of staff members on there. So that's the only adjustment that we see.
Okay,
And with that, do we need to
do we need to make a motion?
re-motion?
Okay, I'd like a motion to amend the minutes of the previous meeting. Do I have a motion?
So moved.
Do I have a second?
Second, Christina Dixon.
Okay, all in favor?
Aye. Aye.
Aye.
You need to vote. So Kathleen.
Roll call. Manzi.
Aye.
Miss Elliott.
Aye.
Miss Cadenas.
Abstain.
Miss Dixon.
Aye.
Dr. McAloon.
Aye.
Dr. Mansdorf.
Aye.
And Dr. Zack.
Aye.
Actually, Dr. McAloon, because you are a new board member and you weren't at and you weren't at the at this meeting, you wouldn't be able to vote on it. So, would you
Very
mind
good.
changing your
We can
vote?
change that to abstain then?
Thank you.
Thank you.
Okay. Okay, so we were going to receive an update from California Podiatric Medical Association.
And Spencer is running a little bit behind. I think he was at the Capitol, so he's making his way over. So we'll
Put
come
that
back
on
to him,
hold.
and we'll queue up Patrick Lee.
So is Patrick here? Great. So Patrick is going to give us an update from the Department of Consumer Affairs Office of Board and Bureau Services.
Good morning. President Manzi, Vice President Elliott, Executive Officer Naslin, members of the board. It is good to see you all again in beautiful, a bit rainy Sacramento. Glad to see we all survived the atmospheric river. Thank you so much for providing an opportunity for the department to provide an update to your board. For the purposes of the minutes and for the record, my name is Patrick Lay. I'm the Assistant Deputy Director for Board and Bureau Services at the Department of Consumer Affairs. And since this is the first board meeting of the year, I thought I'd start this update by providing an update from our office and provide some highlights from 2018 from our office and share with you a few numbers and figures. This past year, our office convened 9 licensing and enforcement work groups, which were work group sessions that convened DCA staff from across all boards and bureaus and share best practices in the areas of licensing and enforcement. We also hosted 3 substance abuse coordination committee meetings, which helped provide boards with additional tools to conduct drug testing for licensees who are substance abusers, for licensees who have a drug and alcohol problem. We also hosted 4 directors' quarterly meetings, which were opportunities for executive officers to connect directly with members of the DCA executive team. And we also hosted 2 board leadership teleconference calls, which were opportunities for board presidents and vice presidents to connect directly with DCA Director Dean Grafilo. We hope that these were good opportunities to promote open dialogue in our shared mission of protecting California consumers. But we're always looking for feedback, so if you have any ideas or suggestions about what you would like to see for 2019, please feel absolutely free to share that feedback with us. Since we're on the topic of 2018 in review, I also thought I'd share that the 2018 DC annual report is now available online. That report provides a comprehensive review of the department's activities in 2018. It is a full accounting of accomplishment for all of the 38 boards, bureaus, and commissions that make up the DCA family. So if you have a bit of time, whether you're a board member or a member of the public, highly encourage you to peruse that report, which is available at www.dca.ca.gov. My next update is regarding the transition to a new administration. And as you know, on January 7th, marked a historic new era for our state as Gavin Newsom was sworn in as the 40th governor for the great state of California. We at DCA are incredibly excited to be part of this new team and are looking forward to doing everything that we can to further the governor's mission. The department has met with the governor's transition team, and many new and familiar faces have been appointed within the governor's office. And as for current gubernatorial appointees, the message is that there is nothing that you need to do at this time, no action needed on your part other than continuing the great work that you have been doing. Our office has been in touch with the new team that the governor has assembled, and will be in contact with them regarding appointments and reappointments in the near future. Related to the new administration, my next update is regarding the governor's 2019-2020 budget. And on January 10th, the governor released his proposed budget, outlining his fiscal priorities for the state. The budget is based on the driving idea of a California for all. It proposes to pay down debts and pension obligations and make significant investments in the areas of education, healthcare, preschool, and higher education. The budget also proposes to make some significant changes in the way that the state would purchase prescription drugs. On the day that the budget was released, the Department of Consumer Affairs held a teleconference call with board leadership, executive officers, and bureau chiefs to discuss the governor's 2019-2020 proposed budget and to review proposals within the budget that were specific to the department. Our fiscal operations team has followed up with every program to see if they had any particular questions about budget details that impact our various boards and bureaus. And I believe that the DCA budget team is here today and will follow my report to provide some additional details. My next update is regarding AB 2138, which, as recall, is the bill that limits boards' abilities to deny a license based on past criminal convictions. Because AB 2138 impacts nearly every board and bureau under the department, DCA has taken steps to support our programs to achieve a successful implementation. DCA provided programs with a draft timeline to stay on track and meet the July 2020 implementation deadline. For the board, it is important to note that in order to stay on track, Action will be required by all programs by May of 2019, and I believe the regs is on today's agenda for your consideration. The department has been working closely with all of the board to create model regulations that may be used to create uniformity. And where feasible, DCA will take the lead on collecting data as required by the bill in order to complete one single report to the state legislature. My next update is regarding the Substance Abuse Coordination Committee, which I discussed a bit earlier. And as you know, that committee has been created in statute. Last year, there was a bill, Senate Bill 796, that required the committee to reconvene and re-examine the standards that are used to do drug testing for substance abusing licensees. The committee met 3 times last year and voted to make 2 changes to Uniform Standard Number 4, which outlines the frequency for drug testing. The first change added language which allows boards to approve alternative drug testing locations and testing frequencies for a licensee going on vacation or taking a leave of absence. This change was added to ensure that a board can still perform drug testing for a licensee traveling abroad while considering the varying types and availability of testing laboratories around the world. The second change is a policy addition that allows healing arts boards to lower the drug testing standards, but only if a licensee receives a minimum of 50% supervision in the workplace. This change was added to reduce the testing costs for a licensee already under supervision and supervised monitoring at their place of employment. This change would be added to a list of exceptions that are already provided under the current Uniform Standard Number 4. The committee also determined that several other standards need to be reviewed. To that end, DCA will be conducting additional meetings throughout 2019 to examine and potentially change other standards beyond drug testing protocols. We will make sure to send those dates to the board and your executive officer as soon as we have them available. My next update is regarding the executive officer salary study. And as many of you know, the department retained KH Consulting to conduct the executive officer salary study. The project is expected to take approximately 6 months with an estimated completion date of March of 2019, so sometime this month. At this time, the consultants have conducted an initial review of executive officers to identify themes and challenges and explore expected outcomes for the study and identify perceived challenges. This past December, KH Consulting sent a comprehensive survey to executive officers so they may conduct a thorough analysis and comparison of positions across boards and comparable entities. So KH Consultants is currently in the process of synthesizing data, and we really hope to have at least a draft of the study coming up soon, which we'll release to all of our boards soon. Wanted to also do a quick note about regulations, and we know that the department has been doing everything that we can to be able to speed up regulatory review. So to that end, wanted to note that the governor's budget includes some positions dedicated to the Legal Affairs Division. The budget change proposal would specifically provide 3-year limited term positions to fund 6 attorney 3s, 1 senior legal analyst, and 1 research program specialist to create a dedicated regulations unit to review the department's significant and increasing regulatory workload. This will hopefully result in improved regulations, timelines, and training for all of our programs, plus faster response times on non-regulatory workload. And then my final update, a bit more tame, is regarding some few administrative reminders. The first one is regarding board member orientation training, or BMOT, and as you know, board members are required to take this training within 1 year of appointment and reappointment to a board. It's a 1-day training in the most beautiful city in the world, Sacramento, which details the important functions and responsibilities of board members. The second reminder is to file your annual statement of economic interest, also known as Form 700. It is required by the Fair Political Practice Commission to report potential conflict of interest. The filing deadline is April 2nd of 2019 and can be conducted online. You are required to file this form even if you do not have any reportable interest. And my final update is that 2019 is a mandatory sexual harassment prevention training year for the Department of Consumer Affairs. This means that all employees and board members are required to take this training, even if they took it last year. This training, again, is able to be completed online. We at the department want to make sure that we do everything that we can to promote a safe working environment for all. With that, that concludes my update. Again, thank you so much for providing an opportunity to provide this update to the board, and I'm happy to take any questions that the board may have.
I have a question. So with regards to the board orientation, has there been any talk about having varying orientations for board members? I know I've been on the board for a while, and I find that oftentimes it's the same orientation given to board members regardless of how many years you served. So I would suggest maybe having one for more experienced board members and one for new board members, because it does become a little bit redundant if you've been on the board before and you've gone to the same orientation over and over and over again.
Sure, absolutely. Happy to take that feedback back.
I do have a question as well. You had mentioned that you are hosting with various medical boards kind of standardized practices, kind of best practices across the board. I didn't hear anything especially with the Me Too movement. Is there a way that the other boards are addressing the Me Too movement, making sure harassment training is part of maybe licensing renewals in any case? So I would just like to hear if
yeah, absolutely. One, as I mentioned, there's the sexual harassment prevention training that absolutely everyone at DCA is required to take. In terms of specific activities in licensing and enforcement work groups, haven't seen the topic specifically put on the agenda, but really we are looking to staff and board members to really help us define what are the important topics that DC entities should be looking at. So if there are particular topics within preventing sexual harassment or any other topics in that vein, feel free to let us know what that would look like in terms of an agenda on the work groups.
And another item, I think Judy, you mentioned it. There's a lot of online office visits that doctors are now providing, and I don't know if there's some type of regulations or if any of the other medical boards are also looking into that as well, but would like to
Would that
know.
be the topic of telehealth?
Yeah.
For example? Yeah, absolutely. It's definitely a topic that has crossed different boards. If it's helpful, I can connect with Executive Officer Nazlan at some point and kind of provide him with a collection of activity that has been made around that topic, if that's helpful.
Anyone else have anything? Okay. Well, I'd like to thank you for your time. Thanks
Thank
for
you.
coming by. We appreciate it.
Thank you very much. Really appreciate it.
Okay, so Ryan Spencer is going now he's our legislative consultant. He's going to give us an update from CPMA.
Thank you for having me. Ryan Spencer. I'm the legislative advocate for the California Podiatric Medical Association. I'll be very brief, although the legislature is not. There are about 2,500 bills in total that were introduced, which is near, I think, a record. The Assembly a couple years ago actually they increased their bill limit from 40 to 50, and members have taken advantage of that on the Assembly side. Of the 2,500, about 1,800 of those are Assembly bills, and about roughly 1,800 and roughly 700 are Senate bills. Of all those bills in total, about 700 are what we call spot bills. For those of you not familiar, members like to introduce legislation that pretty much either change a word or just intent language, kind of a placeholder for other ideas. So if you in your spare time want to review the list of bills that they introduced, just have to know that that's not a comprehensive list, because new bills are going to pop up over the next month as more ideas come in. These spot bills get amended. A couple of those bills are CPMA sponsored legislation. Two of those, one of them is AB 407. What that bill does, it creates an alternative process for both medical doctors and doctors of podiatric medicine to obtain a fluoroscopy permit. Right now, for those of you who are sitting at the board right now who are DPMs and have a fluoroscopy permit, you understand that process that goes to the state is quite arduous. Some of the information there, some would argue, is archaic, unnecessary in the current environment in a clinician's exam room. And so what we're trying to do is try to create a more an alternative process which actually focuses on radiation safety and what the clinician really needs to know versus the physics and all the other stuff that they are being required to know when it's really the responsibility of the facility to maintain the actual machine itself. As many of you know, on January 1st, 2019, the Joint Commission required that all accredited health facilities that they oversee have some type of radiation safety course that they would require all their individuals who use fluoroscopy, that procedure, to be proficient in and to show their competency in fluoroscopy. So what we're looking at doing, and this bill right now is a spot bill because we're still trying to work out the language, but it looks like we have it, is utilizing that process as an alternative to the state process. So if you are in a facility that is accredited by the Joint Commission, and you're going to have to do this anyways, that this new process would be satisfactory to taking the exam. So that's what we're looking into. It is joint sponsored with the California Orthopedic Association. This is one of our many movements to try to find a common ground with that association, and this is one of the bills that we're starting with. We've already received some interest from the other medical associations you can imagine who I would hope would be supportive of the bill as well. The second bill is AB 678, easy bill number to remember, by Assembly Member, the first one, 407, is authored by Assembly Member Santiago from Los Angeles. The second bill, AB 678, Flora, this bill is twofold. This addresses an issue that we've been dealing with for some time, specifically since 2009, when podiatry was removed from being a covered benefit through Medi-Cal. We attempted to do this to get it reinstated last year through the budget process. We were not successful with the previous administration. We're hoping this administration will be a little bit more friendly toward our desires to be able to fully treat Medi-Cal patients. As you know, there are certain environments and certain situations where you can treat a recipient of Medi-Cal, but it's still, you have limitations that apply. So when I say this bill is twofold, it does two things. The first thing it does, it reinstates podiatry as a covered benefit within Medi-Cal, something we've done off and on through the past couple of years. The second thing it does, as we mentioned, if you are treating a individual, say in a particular setting, let's say an FQHC, a rural health center, there are still limitations that apply to you. You can only treat them twice a month, and that's not just podiatry, but if they happen to see an acupuncturist, then that counts for one of the visits, so then you can only treat them one time. So these limitations do not apply to physicians, but yet they're the same exact service. So what this bill essentially would do is, after it reinstate Medi-Cal, it would say that whatever process that a physician has to receive to treat that patient, whether a billing, authorization, or service, then that same process would also apply to a podiatrist. We have it's too soon to say support, but we have the blessing of CMA to move forward with that bill. So there you go. Any questions?
Yeah, I have a question about the last bill you just talked about.
Sure.
So, under like Covered California or a Medi-Cal, for instance, a health maintenance organization like Kaiser sees Medi-Cal patients, and yet no service is denied. So I don't understand
the difference between the two. You're talking about managed care, Medi-Cal managed care. This is really for fee-for-service focus. So fee-for-service is what this primarily will
impact.
Correct.
Okay.
That's a good question.
And then the fluoroscopy thing.
Yeah.
Yes, it's a terrible test, actually, that you have to take, in the sense that even the online information they give you on what to study for this test it was probably written 20 years ago and has nothing to do with the exam. I mean, you have to go out and buy like 3 different books to figure out how to study for this test. So, and it's an expensive license. So are you saying that if this bill got passed, I still have my fluoroscopy and radiology licensing, but I renew it every so many years, and pay a pretty good fee for that. So are you saying that if this passes, as long as the facility that you're using the fluoroscopy unit in is up to par, or passing all their we have one in our clinic, for instance, a fluoroscopy unit, and every time I use it, I have to put in the patient's name and how much fluoroscopy he got, how much radiation he got, and how many moments I used it. My residents can't press the button because they don't have their fluoroscopy, licensing. yet.
Sure.
So is that what you're saying?
Essentially, what we have right now, what we have right now before us is a skeleton. We're still working on putting the meat on the bones. I think a conversation with the Department of Public Health, the Radiological Health Branch, the COA executive director had an initial conversation. We're going to follow up with a joint conversation to really kind of flesh this out some more, explain them what we're trying to do. But I think what you're saying is the Joint Commission has the particular standards. I think they're actually going to require that there be what's called a radiation safety officer that's going to be designated for ensuring that those individuals that are using fluoroscopy, the procedure, to meet these essential radiation safety requirements that will be required by the Joint Commission. So it's new. This is just established about 2 months ago. And so this is something you're going to have to do anyways, regardless of if the permit exists or not. And the permit is going to exist. We're not doing anything with the RHB fluoroscopic permit. What we're doing is we're creating an alternative, and we're using this new standard by the Joint Commission as being that alternative. So it would be a little different than what you're experiencing now. But in essence, yes, that's we're trying to create an alternative process. Exactly how that process would work, and exactly what these standards will essentially be, is something that we have to have discussions with the department, and frankly also a couple of medical associations, the radiologists, for example, have a strong interest in this as well. We've been having conversations with them until we can actually get the details put together.
For Bill AB 407, what is the benefit to the consumer of having this alternative process?
Access. I think if you have a long delay process, because the state process is long, it's bureaucratic, it takes 6 or 7 months, if you're lucky, to be able to be certified in permit process. With this process that be done by the facility, it'd be much quicker. If you are performing procedure and it requires some type of fluoroscopic procedure, you have to bring another person into the room to do it for you if you don't have the permit. And that, who knows the availability of that person, the patient might have to leave and come back for it, or you might have to find time with the radiologist to do it. What this is trying to do is increase the number of people who want this permit, to have this permit, to be able to treat these individuals in a more efficient manner. And I want to be very clear, radiation safety is the reason why we're not jumping and putting language in this bill quickly is because that is of paramount importance. We want to make sure whatever we do, that radiation safety standards maintain a very, very high level.
I have the same question for AB 678. Can you just talk about how that expansion provides better affordability or access to services?
Access to care?
Yeah.
I'll use the 2-visit example. If you go to an FQHC and you are seeing a podiatrist, the way the law reads now, or the regulations read, is you can only see that podiatrist twice a month, regardless of what type of condition you have. So in your medical opinion, you believe I need to see this person every week. You can't, because the limitations are you can only see them twice. So the person will either have to see a physician who doesn't have the same restrictions, or they see a podiatrist. As you know, there is a shortage of physicians in California, and we are working hard on improving that situation. In the meantime, very well-qualified people in a particular profession and specialty, such as yourselves, who are doing the same treatment that a physician would do, should be able to have the same type of access to that patient.
Yeah, it particularly comes in with wound care, because you could see a patient with a severe diabetic ulcer, maybe had a partial amputation, now maybe has a wound vac. You can't just say, okay, see it twice a month. That wound vac needs care, it needs observation, the wound does. Plus all the things that they're doing now for limb salvage with interventional radiology and stenting. I mean, it's a very complicated, and I think podiatry has taken the lead role in limb salvage in the state. And I think that it's very important that it's available to everybody.
Dr. Manzi?
Yes.
May I comment on that as
Please.
well? As you mentioned, to those of us who are not podiatrists, it's critical. The standard of care for these diabetic patients is to be seen weekly for these wounds. We debride them, we monitor their wound care, and for the rest of Californians to have access to a podiatrist for that care every week. And for those of us, the most vulnerable among us who have Medi-Cal, not to have that same access to podiatrists to get their wounds treated weekly, I think is immoral. I think this bill is very important.
May I add, Madam President? a statistic that came out, and you can't necessarily largely attribute it to the elimination of podiatry and Medi-Cal in 2009, but it is there's a parallel connection. Between 2009 and 2016, the rise in amputation rate went up 31%, which you guys know. So, I mean, even though you cannot directly correlate the two and say exactly that's how it happened, but I think you can assume that that number likely would have been much lower if they had access to more providers and specialists such as podiatrists.
Along the question for AB 678, we had presentations in the past talking about the limited number of providers that are willing to accept Medi-Cal for care. Would that create a positive participation in terms of podiatrists coming in to provide more services for patients in a federally recognized health clinic, for example? Or would it create a jam of demand for services versus number of providers available?
Notwithstanding the rate itself, which is a constant struggle that both our physician partners and doctors of podiatric medicine are working on improving, I think this current administration will think more favorably on investing in the Medi-Cal rate. Notwithstanding that, the fact that the process that a podiatrist has to go through to be reimbursed through Medi-Cal is onerous, it's laborious, and gets denied quite a bit. In fact, having conversations with some members of CPMA, nobody at the table could identify somebody who actually received an approved claim. I know they've existed because Senator Dr. Pan, requested information from the department on how many claims have been approved, how many claims have been denied. I wish I had that number in front of me. I would cite it for you, but the number of denied claims far outweighed the number of approved claims. I think a lot of it had to do with the fact that, they didn't simply just didn't cross a T or dot an I. So I think some podiatrists might just get frustrated with the process and just stop treating Medi-Cal patients altogether because they're just it's just not a good system. And so if we improve the system by streamlining it to say, hey, whatever applies to a physician also applies to a doctor when they're performing the same exact service, I would be willing to bet that that would improve access because more DPMs would want to provide that care. I won't say want, I think everybody wants to provide the care. Are they able to provide the care? And this would enable them to do that.
Thank you.
Thank you very much.
Thank you very much. Carl Behrman. We're going to receive an update now on budget and fund condition for DCA. And Mr. Behrman, Associate Budget Analyst, welcome.
Thank you. Good morning, all. My name is Carl Bierman with the DCA Budget Office. I'm happy to be here to provide you an update on your budget items. I'm going to start with just a high-level overview of the budget process. As Patrick mentioned earlier, the governor's budget was released on January 10th. And at the budget office, how we go about building the governor's budget every year is incremental budgeting. What I mean by that is that we start with last year's budget act every year. We don't start from scratch. And we factor in any incremental changes that there may be. The most common items every year are things like employee compensation and retirement adjustments. And if your board has anything more specific like budget change proposals, if there's an executive order specific to your board or budget letter. And we factor all that in and come up with your annual budget for the governor's budget. I would also like to go over the board's fund condition, which would be this document, if you can follow along with me. And the fund condition is comprised of essentially three main sections. The first at the top, as you can see, is the revenue and transfers in. So this is revenue generated by your board's licensing fees. At the last board meeting, the board correctly pointed out that the renewal fee increase that Brian procured was projected in the out years when it's only a 2-year fee increase. I took the board's recommendation and updated that. As you can see in red, we have your projected revenue from the fee increase for only 2 years now. The second part of the fund condition down towards the bottom is the expenditures. So this would be funding coming out of the board's fund. you have your essentially your net appropriation for every year, and I also built in, as you can see in the out years, estimated savings of $300,000 every year for the out years for the board. The current year, there was a $200,000 estimated savings built into the governor's budget for the board. And this is essentially savings that we're estimating to help keep the fund solvent. It's like a forced savings. And as you can see, down at the bottom, the fund balance and months in reserve is starting to go down. And in the budget office, this is what we call a structural imbalance, as the board is well aware. Each year, you're spending more than you're bringing in, essentially. And I know it's been brought up that a fee study be done. I think you guys are ahead of the curve for that. It'd be good to get that done before your sunset review process in the upcoming year. I would highly recommend that we get a fee study done for you to correct that imbalance. Any questions on the fund condition?
Yes. So the first question is, I'm noticing that starting in 17-18, we're seeing an increase in expenses. Like 17-18 from to 18-19, that's like a $200,000 increase. Can you speak to what's driving that?
A large portion of that is the SEIU 1000 agreement. All the state employees are getting, there's 4% increases. This next year, we're getting a 3.5% salary increase across the board. Pardon me. Because benefits are often a percentage of salary too, benefits are going up across the board as well due to the salary increases.
So is it possible for the board to get a breakdown of that? Because I mean, that's pretty drastic, especially to our fund condition.
Mm-hmm.
And, seeing as how the fee increase is kicking in, the renewal increase for 18-19 and 19-20, but the expenses are also increasing. So our goal was to provide an opportunity to increase the fund, but if the expenses are going up in relation to the fee, then we're pretty much balancing out, right?
Right.
So, knowing that and knowing that, I appreciate the SEIU increase for staff, but from a board perspective, what is the governor's office thinking about as far as helping balance that out for smaller boards?
Well, that's one of the adjustments that you get each year is for that. So your appropriation is increasing accordingly. But I believe what you're worried about is because expenses are going.
Yeah, so expenses are going up. So we're taking proactive approaches to
Correct.
generate additional revenue, but expenses are going up on par with that. So then it's almost counterproductive to the goal of increasing the fund condition at the end of the year so that we have more money in reserves, right?
Correct.
Right.
Yeah.
The other question is, with regards to the revenue, so we're seeing, especially from last year, we saw an increase in the number of new licensees coming in. But I'm noticing that the renewal fee, you have it flat. So where does that get factored in? So if we have more licentiates coming on board, does that get factored in when you re-up or true it up for the following year?
Yes, we'll make adjustments based on actuals.
Okay.
So right now, this is just projected for current year, and budget year +1. Prior year is actuals on the fund condition. So once we know what it actually looks like, we'll make an adjustment in the projections for that accordingly.
And is that done on an annual basis, or do you do biannual check-ins? Like, how frequently is that adjusted?
We can adjust it more frequently if you like, but yeah, it's normally on an annual basis.
And then on the estimated savings, who makes that determination of what amount is estimated to be saved?
That would be us, the budget office, based off of what the board's needs are to keep the fund solvent. One thing too, and this ties into the second document that I'm going to go over, the expenditure projection. One thing I noticed too that might have been driving the cost going up was it looked like there was an increase in the Attorney General cost for you last year. So I'm not sure if the board just referred more cases last year or what, but board staff should be able to brief you on what happened there.
Before you move on to the
Mhm.
next page, back on expenditures,
Mhm.
statewide general administrative expenditures pro rata.
Mm-hmm.
Why are you estimating a reduction for financial year 2019-20 and 2021 when we're averaging between 92, 81, and now we're dropping down to an estimated $61,000?
Those numbers are generated by, the state controller's office and the state treasurer's office. So those are numbers that we got directly from them that they would be charging you. Why their costs are going down, I am unsure, but I can look into that for you.
Well, everything else seems to be going up. And
Yeah.
when we're looking at our number of months in reserve.
Mm-hmm.
Well, that would throw us under the bus much sooner.
Yeah, yeah. Okay. So moving on to the expenditure projection, that's this colorful document. As you can see on this document, we included 3 years of prior year data, so you can kind of compare trends, as well as the budget act of this year and your projected expenditures. And I know there's some red on here for each individual line item. However, the main thing that we pay attention to is the bottom line. So down in the bottom right corner, the net expenditures is in the black, which is very good. And this is a very conservative projection too. And what I mean by that is like take for instance, if you look at in the enforcement category, Division of Investigations, for the past 3 years, if you look at the past 3 years data, the board spent between 40 and 60,000 on DOI investigations. However, we have you projected spending the full appropriation for DOI investigations. I would say the board will probably spend about 100,000 less than that, which would put your expenditure projection at reverting about 115,000 this fiscal year, which is very healthy.
So I have a question.
Sure.
In our packet, we have this one as attachment B, and then we have attachment C, which is the fund condition analysis.
Mm-hmm.
How does the expenditure projection relate to the fund condition?
So the actual expenditures for the prior years would tie to the fund condition. So if you look down at the bottom, a total expense for the column on the expenditure projection
Right.
for 17-18, the 1168, ties to 17-18 expenditures on the fund condition, the 1168.
Okay.
So the current year on the fund condition, current year and budget year for the fund condition, we anticipate that you just spend your full appropriation. That won't be the case. As you can tell by the expenditure projection, we anticipate that you'll revert money, so you will not spend your full appropriation.
Right.
So once we make that adjustment, once the current year is closed out, it'll actually be an improvement for your fund. You'll show approximately $115,000 extra added into your fund after this fiscal year.
So then on the expenditure projection, I'm seeing several adjustments for the scheduled reimbursement other, unscheduled reimbursement investigative cost recovery. How
Mhm.
does that get factored into the fund condition?
That gets factored into the fund, and it's a little weird how reimbursements are treated. Reimbursements, even though it's revenue in, it's not treated as revenue. It's treated as a negative expenditure, which can be
So you make an adjustment?
a little, yes,
Right.
yes.
And so then when is that reflected? Is that a part of your true up again? So
Yes,
like for
yes, at the end of the
18,
fiscal year,
19?
we'll factor all of that in. But because we can't plan for something that's unscheduled,
Okay.
that's not factored in current year.
So then for the next one that comes to the board, would that be factored into the 17-18? Because I'm just trying to make sure we're understanding, the bottom line net expenditures is 1.089, right?
Mm-hmm.
But on here, it's 1.168. So every little bit counts and helps towards the fund condition.
Correct.
So that'll be trued up in
Yes.
the next
Mm-hmm.
one that comes to the board.
Yeah.
Okay. And then the other expenditures that we're seeing on the fund condition, the ones that are in the later, the 800, the 8,000 and the 9,000 series, I'm not seeing that on the expenditure. So are those,
Those are direct assessments to the fund.
okay?
So that's not part of the board's appropriation.
But it's counted against the fund condition.
Yes. So what I mean by a direct assessment is that's funding that's taken directly from the fund. So, fiscal, the pension payments, statewide general administrative pro rata, that's services, like I said, for the state treasurer's office and state controller's office. They assess your fund directly, so that's not part of the board's appropriation. So you have your separate expenditure authority to spend your own budget, and that's just money that's taken directly out of your fund for those purposes. Does that make sense?
It's not on here.
So just for understanding and clarification, I know in the past year, because of changes in the accounting system, and we had delays in receiving the expenditure projections and the fund condition report. Considering the state of our fund and where we're looking at, even as we're going to sunset review, has the timeliness of this reporting been now caught up so that we'll be getting updated financials prudently so we can indeed add on the items from the fund condition that are not in the expenditure report in consideration to our expenses?
So you're talking about like fiscal reports?
Yeah, I just want to make sure that we're going to be able to get the fiscal reporting in a timely manner so that we can take corrective action if needed.
Yeah, so I believe Brian included the fiscal memo that was just issued on February 20th in your board packet that will be covered later. DCA is on track to close out the last fiscal year this month, which is what our target goal was in the last memo that was issued. We're not alone in this issue. It's the whole state is having issues closing out last fiscal year as well as individual fiscal months. But as we become better and more, I guess, used to the system, you will be getting those financial statements and reports in a more timely manner. The system is capturing all of the financial transactions that it should be. It's just the way that data is extracted. So essentially what I do to come up with this expenditure projection is we get a data dump from the system. I then have to apply lots of filters on it and sort by account code to come up with this projection for you. So this is an accurate projection for the board. We just don't have a nice looking report for you that you've grown accustomed to at this time.
So this is final? This is the final projection for 17-18?
Not the final. We update it by month. This is based off of fiscal month 6, so is that at the close of December? Just the timing on when we needed these due for your board packet versus when we got the data for month 7. I update this projection on a monthly basis.
No, I mean the 17-18. You've already closed out 17-18. So
No, 17-18 will be closed out in fiscal this month.
this month.
Hmm.
So these numbers could change?
They could change slightly, yes. It's based off a prelim 12.
Okay.
Hmm.
Does anybody have any other questions? Okay.
Okay, thank you.
Thank you very much.
You're welcome.
Okay. So Brian, you're up next. We're going to get an update, receive possible action on executive officer's report.
Okay, let's have Andrea come up for licensing and be a co-presentation with Dr. Manzi.
Okay, we'll start with licensing. So now we're going to review the licensing statistics for our quarter, running from October 1st, 2018 through December 2018.
So we're going to start with the new licenses issued and renewals for quarter 2. There were 15 permanent licenses issued for quarter 2 with a total of 41 newly licensed DPMs for this fiscal year to date. We have a comparison of the gender, age, and incoming to outgoing DPMs provided for review. And the categories for the outgoing licensee population include retired, inactive, disabled, and canceled licenses. There are currently 28 initial applications pending with one candidate that recently completed their package. And so far for fiscal year 18-19, the BPM had 11 applicants come from out of state. 15 were third-year residents from California, and 15 were third-year residents from an out-of-state program. Moving on to the renewals. In October, there were 95 renewals mailed with 90 licenses renewed by end of month, and November had 81 renewals mailed with 72 licenses renewed, and December had 89 renewals mailed with 82 licenses renewed by end of month. Delinquent renewal notices were mailed to those that did not comply with the renewal requirements 30 days after expiration. Moving on to the resident data, there was one resident added to the third-year resident rotation list, bringing the resident license total count to 123. And those are the licensing statistics.
Okay. But, okay, so I had asked for them to break it down for which they did nicely, thank you very much, for the gender as well as age, and both for income, and then how many incoming and outgoing licenses that we had. And, you know, one of the reasons was because we were also looking at some of our expenditure with the Attorney General, of course, has to do with, you know, what cases we have to review as far as enforcement. And the reason I had this done, honestly, was to see more of age grouping, and maybe we can get an idea of the projection of what we can anticipate, because I think when we get to the part about the enforcement, it was very telling with the age groups. It was, they were all pretty much clumped in the same age group. So the reason I guess I bring this up is because a lot of our licensing comes from our residency programs, and we are the ones that are licensing our residency programs. And so that's why we have to take that licensing or that and we've discussed this before, from the graduate medical education podiatry board that goes that goes around and looks at those programs and okays them.
CPME.
Yeah, CPME. So that, I think, was, one of the things that drives all these statistics. Whether or not we're going to be able to see anything, of consequence was why I kind of was looking at these statistics. So thanks for getting those for us.
Can we ask questions?
Sure, go right ahead.
So I have a couple questions. So the first question is, when we look at the current active license total
Yes.
for FY 18-19, can you help me understand the number that's being reflected for the October through December timeframe?
This is just the number of total current active licensees at the time the report was pulled. So this number can change daily even. So these are just what I pulled in preparation for the Q2 report.
Okay,
it
so
can
then
fluctuate.
is some of that 2,205 inclusive of the 2182 that we had at year end 17-18?
So these are the same. These numbers were pulled from whatever the last report you guys saw, showing for that fiscal year how many active licensees there
Okay,
were.
so then if I'm trying to do math, right, so if the 2182 and if I add the 41, are you saying that you can't do it that way?
No,
No,
because
because you're saying it
all the time.
fluctuates all the time?
People go delinquent, people cancel out or retire, so it's going to change.
Right.
Okay. So then, my next question is with regards to the initial license application. I see that there's 27 incomplete. So then, what type of follow-up is done with the incomplete licensees? And how frequently do we follow up with them? And then how long does someone have before
You start the process.
you start the process again, right? So can you stay in an incomplete status for over a year and then have to start all over?
So an application will stay open for 365 days. And at that point, we can reopen the application, and it just depends on some of the required information. So if they submitted license verifications, 11 months prior and didn't complete the process within the 365 days, we would request a new verification to have updated information. Every day we get mail, I attach it to the licensee file, and I'll send follow-up either emails or a phone call, or send a letter saying, hey, this is what we're still waiting for. If they apply online, they should be able to see a deficiency section, because when I go in there, I can mark what we're still waiting for. So if they apply online, they are able to see what documents we still need.
So if I apply online, can I submit documentation electronically, or do I have to mail it in?
So the application can be submitted electronically. Any explanation to yes questions can be electronic. The payment. Other than that, there's a signature form because you can't sign online. So we do require that to get mailed with a photo. Sometimes they fax it, but we can't see the picture. So we do require an original signature. Other documents need to come directly from the schools or the licensing agencies. Or their exam scores, they can't submit those themselves.
And have we even done a study of are there commonalities that exist between the incomplete licensees? Because I'm just wondering if there are barriers that is consistent across those who are incomplete, and if that could be opportunities to maybe look at, some changing in regulation or requirements. Because the reason I'm asking is the licensee is our major revenue stream, right? That is how we generate revenue. And so we would want to see everyone who starts an application complete an application, or at least have some very good understanding as to why they're not completing. So I think that would be a very useful kind of assessment, just to see, are there some commonalities that exist, and how long are people starting something and not finishing, and then why?
So this just means we haven't received all the required documents. So sometimes they'll have submitted everything, but it gets lost in the mail, so we'll have to re-request another
Right, so my point of
copy.
why do they, is there an opportunity for them to submit things electronically versus mail? Because, I mean, a lot of entities are moving towards not even taking paper documents in, like, dumping something in a file as a PDF, because things do get lost in the mail. And so from a licensee perspective, that could be a barrier, right? Because if I submitted it once and it gets lost, and then I have to submit it again, that's a lot of time, right?
That's one factor. Another could be maybe they didn't pass the Part 3 exam, so that's 6 months apart. So we'd have to wait, sometimes a year for them to actually pass the exam before they can get licensed. Sometimes they just don't finish the process because they get a job in another state. I've heard that. But usually they complete the process.
When do they pay the fee?
They can pay it at any point during the application process, but a license won't be issued until we receive all the fees.
So out of these ones that are incomplete, is it safe to say none of them have paid the fee yet?
No, it could be a variety of reasons.
Right, okay.
Could be the background clearance hasn't come back yet, or they haven't asked for went and had their prints taken.
Is there an application fee?
Yes.
How much is that?
$100.
Can we look at that being changed?
We just changed it.
We just changed it, okay. That was just raised?
Yes,
Yeah,
it's
okay.
$149
Okay.
total.
Because your point is, well, I think what I'm hearing is that there's a lot of, even if this person never gets a California license, you've done a lot of work
That's a good point.
on their application.
Maybe
Right, we don't
And
refund an application.
Right, and so, and I don't know what the price was previously, because I remember,
I know a lot,
yeah.
but yes,
So
you're
the point is, a California license is very valuable to a podiatrist, and I think the application fee can be higher given the amount of work that you ladies need to do to get that done. Is something to be considered. But the question is, will it be as you're asking, is there obstacles to getting a license? And so you have to weigh the pros and cons. But a lot of the issues that were mentioned are true. You're a resident. You're applying to a lot of different jobs. You got to get a license. You might be throwing out applications at 5 states, or perhaps because you're trying to find a job or what have you, and then you get one, and the other 4 you're not even going to finish because you don't know yet. It's like applying to college. You're kind of spreading out your opportunities until you know which one's going to pan out. So some of these people may never complete the package for whatever reason. So, but there's still a lot of work involved, and you're looking at it every day, waiting for that. So just to make sure that the price of the application reflects the amount of work without scaring anybody off, I think is valuable. Are you able to answer that question, give us more information about how many people, what's the percentage of people who apply get a license? Do 50% of applicants wind up getting a license? I mean, I'm just making up numbers, so that we have some sense maybe of what that is. And is it even possible to track if they don't complete their application? What was the reason? How many because they didn't pass? How many because they got another job? I don't know if that information is valuable or if it's worth your effort to do that, but that's what I'm hearing being asked.
I would say that I would recommend that the application, and when you ask for an application and you start your process, I don't think you should start the process without payment, whether you complete your application or not. I mean, because once again, she's right, you're working.
Right. And it is, let me jump on that as well. I know we talked about for our budget to doing a fee proposal study. Is that something that's considered as part of that?
Yes,
Okay. And is it an action that we need to take?
that is on the agenda
And
today
perfect.
for an action item, motion,
Oh.
and approval.
There we go. Thank you.
Okay. Do you have any other-
I do. So on the licensing statistics, I just have a recommendation. So I do like the graphs. Visuals are always great to help relay information because people learn and see things differently. But my recommendation would be instead of using the numbers, I would recommend percentages. Yeah, so like instead of saying 68, it would be, what percentage of the total pool is in the 31 through 40 age range.
Okay.
Okay.
And I do have to say, Andrea did an outstanding job
did.
because she had to start from scratch because this has never been done before as a request. It was very workload intensive. And Bethany and Andrea also had another drill to do that was very labor intensive. and to stick with your regular duties, the phone calls, all that stuff. So good job, guys.
Thank you.
I second that. Okay.
I have a question before you move on.
Mhm.
On page 6, the breakdown of initial application categories where you have out-of-state applicants, I'm just curious if you have an estimate of how many of those might be fellowship trained, and that's why there was a delay. They weren't a third-year applicant, but they may have applied the following year. So it's not an established provider who's coming from out of state who's been in practice for 15 years. This was a fellowship-trained individual, so 1 additional year of training. I'm just curious if you have.
I don't currently have
Yes.
it tracked that
But
way.
But I have a question about that. So you're talking about a fellowship from, say, out of state, not necessarily California, because or even in California, because a lot of the third years in California go into they already have a residence license, right? So then they go on to their fellowship training year licensing. I mean, is that a different license?
Well, it doesn't fall into the categories that are here, so this only looks like a third-year resident applying.
Right. So I guess your question is what kind of a license does the fellow get?
No,
Here
it's the
they're
number of
practicing
applicants.
their fellowship.
They would be,
Because
I
if
see
they're
what you're saying.
practicing their fellowship in California, they got some kind of license.
Active license, because you have finished the third-year residency.
that's right.
So it has to be an active license,
That's
not a
true.
residence license if you're a fellow.
So it would be
Out of state.
an out-of-state fellowship.
Possibly.
Possible, but they're out of state doing their fellowship. Okay,
Right.
So then there'd just be a new licensee.
Yeah, so what you're asking, Neil, is how many of these are really a new practitioner versus an established practitioner coming to California?
Right.
I mean, then you could even do military, I mean, it depends on how much, then you could see
Well,
how many
we-
are coming out of the military,
Yeah,
you know,
right.
it could get, I mean, it depends on what data you have.
Yeah, we don't need to extract that
Yeah,
much
yeah.
additional time,
Yeah.
but I was just curious if you had any estimates.
I don't currently track it that way because the application usually just asks for residency
Okay.
program, so that's what I verify.
Thanks.
Absolutely. Okay, so CMEs. We were doing auditing of CMEs. So talk about that a little bit.
So the March 2018 CME audit is now complete, and out of the 23 audited licensees, 16 have been found in compliance and 7 have filed for a CME waiver. The licensees that received the waiver will be required to submit evidence of compliance prior to their next renewal cycle, and any licensee who fails to provide the required documentation shall be ineligible for renewal to practice until such time as all the requirements are completed and documented to the board.
Yes.
What percentage of our licensees do we audit for that, CME?
I believe it's 1% of the total.
Every year.
Every year it's 1%, and if you've been audited before, does that alter your chance of getting picked again, or is it random every year?
It's random.
So regardless if you've been picked before or not before, that has no influence on whether you'll be picked for 1%.
We do it twice in a row, so.
Yeah, no, I mean, they can only get audited once every 2 years. So,
Thank you.
And then,
Just to remind our new board member, this is, one of my partners was called on the audit, and he gets more than enough units every year, but he didn't realize it was from licensing year to licensing year, and he got 40 units just outside the licensing year. Plenty of units, but it didn't qualify inside. So he has to make it up somehow, but, not everybody that fails that actually didn't get their CME.
Oh, agree, I wasn't implying that, I was just.
I know, I'm
curious
just saying that
process.
it's kind of curious that, some people didn't get their CME, period, and some just did it outside the licensing category here.
and
okay, so we can, we're moving on to the
part 3.
APMLE, the American Podiatric Medical Licensing Examination Part 3 results. The last Part 3 exam was administered on December 5th of 2018, and there were a total of 27 candidates that requested their scores be sent to California. Of those candidates, 27 passed for a 100% pass rate. The next Part 3 exam will be held on June 5th of 2019, and candidates wishing to participate in the next exam will need to register by May 24th.
So the next part about this is the licensing and enforcement data that we had asked to see for the. This is a large part of our budget that we spend is enforcement, and it's like anything else. If you can try to minimize this, we'd be in better financial shape. So if you look at attachment D, this was a lot of work. But if you look at attachment D, what we were looking at was what we had asked, the residency program, the type of discipline, the years in practice. This was just trying to get an idea of, first of all, why are people getting disciplined? And if there's any kind of pattern to it. Also, what I noticed when I read through these, and I don't know the answer to this, is if a person is having a discipline because of a not so much gross negligence, but maybe more of a drug or alcohol related, personal breakdown related discipline, is one much more expensive than another for just prosecutory, or our expenditure as a board.
Can you repeat the question, because I'm not sure that I fully understood it?
So if you look at if a person is someone, if you make a complaint to the board about physician, we have to investigate it, right? And then we have to hire expert witnesses or whatever. So but people can be disciplined for many different reasons.
So are you asking if certain types of unprofessional conduct, we'll just use that as an all-encompassing term, are more expensive to prosecute than others? That's a good question. I don't know that answer. I can look into it and get back to you. Because that's really, I don't see the AG's bill, and the enforcement part of like the investigation and all that goes through the AG's office. So you can request or I can request, or somebody can request a report from the AG's office to give you more information with regard to that, because I don't have the answer, but I can work on getting that information for you.
That'd be great.
I think we could ask our liaison over there for information on that. Probably has more to do with case complexity than what type of case it is as far as expenses go. Number of hours worked on the case would obviously drive costs.
I just want to express my thanks for the diligence of putting this together, because this is actually really helpful in understanding, like you said, like the role that enforcement plays and our role as a board, but also to see the patterns. I believe when we initially discussed this, it also had to do with what can we do to be preemptive and providing information or guidance to licensees to not get to the enforcement level. As you put this together, I mean, just looking at the data itself, there are some patterns, but I'm wondering if from the staff level you have any insights that you would like to highlight of the report provided.
We don't actually. This was requested by the board just to go over, and then whatever information you want to pull out of it, and we can take your direction from there.
I think that one glaring thing that came out of this, for me at least, after I looked at it, and have been a person who has reviewed disciplinary complaints, etc. One thing that always comes through is this inability or lack of documentation of what these people are doing in their office and what the documentation look like, or the lack of documentation, or the inappropriate documentation. And it's interesting because if you look at their ages, it's kind of is clumped together. And, I'm not, listen, some of the acts are, not just because of poor record keeping, but I think it's telling, of a story of like maybe things have changed as far as the way practitioners understand what their responsibility is as far as running an office, especially in private practice, and where you don't have an electronic maybe medical record, to pour all this information and to keep guiding you towards, there's so many prompts now, even from, disallowing a lot of this.
Well, I did notice that solo practitioners were highly represented in the sample that was given, and I didn't calculate the average age of those that were rated, but it sounds like you did, Judy, and it seems to be clumped to an older demographic
It is.
for it. So I do think that if we're looking into enforcement or preemptive activity, it calls to attention the solo practitioner, and maybe targeting a certain average age group to provide guidance on tools for either documentation and others. Not that that's the primary reason for enforcement, but I think it gives us guidance even to the staff on how to support licensees. And I do want to call out, it was to me very glaring, the gender demographics of the sample. There were 35 enforcements and only 2 were female and the rest were male. And I know that we have an imbalance in terms of gender, in terms of more men than women in the field, but that's closer to 40-60, not this. So I just want to call it out to put it on the record. That's something that we need to think about on what that means in itself, and maybe looking if it's sole practitioners predominantly male as well, and understand what that means for the field and what it means for consumers in terms of how we are supporting them out there.
Well, I think certainly for the gender, for the age we're talking about, that's going to be primary solo practitioners, because we didn't have those opportunities that we have today to be employed in medical
Medicare.
groups. They didn't exist. Or they had hired very few podiatrists. So there's that age group is going to be primarily solo practitioners, just because of the opportunities that were available to them when they started practicing. So, and they're also much more, I don't know what the numbers are now of us who are licensees or private practice versus medical groups, because that has increased over the years.
That
So
would
that's
be a
not
good
as
thing to
so
know.
that's not as helpful as it looks, I think, in this list, because that age group is going to be primarily private practice overall.
Yes, I agree. You're right about that. I think the point I'd like to make, though, about the increase of people, of licensees now practicing in a health maintenance organization of some sort, where there's chronic peer review.
Right.
It speaks highly of chronic peer review.
Right, you're right, because in solo practitioner, there's no one looking. Where if you work in a medical group, someone else is auditing you, reviewing you. You have a supervisor.
Right.
There's a more, for sure, that environment would probably have. Solo practitioner allows itself to have less oversight by the nature of the practice. So that you would expect to have higher disciplinary actions, because no one else has checked it ahead of time.
And I also think that the resource that a solo practitioner has for, once again, record keeping, and what they're what they're supposed to be doing record keeping wise. I think, because if I was in private practice, I know what kind of records I kept when I was in private practice as opposed to what I do at Kaiser, it's like. So, I just think that the importance of it is glaring.
Yeah.
Because just sitting down and really writing and thinking about what did you just do, what did you just say to this person, what should be done, makes a big difference. Anyways, so some sort of educational, I don't know. I think it's something to think about, because it's prevention is key.
And I also want to thank staff. I mean, this was really insightful of where we're at and where we need to be, but also telling the story. So I would like this report to be brought to public education, so we can figure out how we can kind of, again, an article, if it goes on our website, this type of data, just so that it's out there and people understand. These are kind of the top reasons people
get in
lose their
trouble.
license.
Right.
Yeah. Thank you.
Thank you.
I also have just a couple comments. So when I was looking at the report, one of the things that stood out for me, number one, the question I have is, what does not applicable mean? And is there any way for us to get a better sense of where the person did their residency?
That means that I couldn't find any information in the file or in Breeze. So
Okay.
I didn't know what to put.
So when I also started breaking out the statistics, over 18 of the 35 were either not applicable or out of state on this list. So for me, that starts me to thinking about, is there an opportunity to do some additional training for folks who are coming from out-of-state residences into California? And are we giving the same training across the board to everyone? So it's just trying to figure out how we can use this information. I know staff hasn't had a chance to kind of digest it and think about what it's telling us about opportunities to do additional training or maybe enhance the training that we have. But that's what I would encourage for us to do looking forward, is to kind of, once you've done it, you did the heavy lift, and we appreciate that effort. But now looking at what is it telling us, and then how can that help inform what we may need to be doing with our trainings moving forward,
For incoming licensees.
and even for existings.
This may be a self-healing problem. If you look at the ages, I think the 60s and 70-year-olds most likely did not even have a residency.
Yeah, the laws were different.
And there's only one 30-year-old and no 20s. So I think that the education and training we're providing for the newer graduates is eliminating their problem.
The information we were unable to find was like the late 70s, early 80s, where we didn't have documentation on some of these.
So I'm hoping that's true, and therefore, we should be seeing less and less disciplinary action because it's much more, you have to have a 3-year residency, you have to, it's a different breed of people coming through, I guess, or, level.
Experience is different. Education, training, and experience is
Right.
improved versus
Our
how it was
standards have
then.
increased.
But I think it's an important thing to know because we just did our budget review, and I think it does. I mean, you don't have a crystal ball, and it's not saying that there won't still be complaints, but we're hoping it's going to.
Yeah, I think as we look into the analysis of this data, along with the other licensee data available, what I'm wondering is, if we're looking at the average age of those that have some enforcement against them versus the total population of licensees, what is our average age there? Because if I'm looking at the new licenses issued, that age group that we're talking about that's falling on enforcement it's 4 to 6% of our total new licensee pool, right? And if that's costing us our large enforcement budget expenditures, I think it behooves us to really look into how do we address this for that population.
Yes.
So I take it this report is helpful, so we'll keep this going. I think Christina made a real good comment. There's a story here. There is a story here. The enforcement actions don't come all that often, but they're there. So to really start to paint this picture, we're going to have to, like you said, take a deep dive into it. We'll keep this. Is this a report you want to see every board, or is it once a year? Because it is very intensive.
Yeah, maybe
Once a year? Okay.
Maybe twice or.
Biannual?
Yeah, you could just update it.
Okay.
Now you have most of the data. Exactly. The new ones, yeah.
It won't be that difficult to add year after year.
Yeah, because
Good
it's
job.
the framework's done and the digging's done, so when one comes up, we can just add it, right? Yeah.
Thank you. It was really well done. I appreciate it. Okay. Does anyone have any more comments about that? If not, let's go to the calendar for March through May. Let's see. As far as if you haven't had your board training and you are reappointed, like myself, there is a date coming up for board training. Let Joseph know, because you do need to attend that.
Yeah, I was going to ask Patrick, are they going to have the orientation board meetings in Los Angeles area at all anymore?
We are potentially working on that. I'll get back to you on.
Because I think that would be really helpful for especially some of the board members here. And I know across the other boards that it's a difficult travel back and forth for one day.
I'll double check. Cool.
Okay. So our next board meeting will be not till June, right?
June 7th in Riverside.
Oh, yes. And our committee meetings will be?
May 15th.
Okay, May 15th. And those are, I think, the big ones. Except I do think if anyone's interested in that board training one, I think it's April 27th. Is that right? Is it?
I don't usually add those on here, but
I know. I have it on mine only because I have to go. And I know, Caroline, you have to go. Yeah, you probably do too. So, actually, it might have been. Well, we'll make sure Joseph gets it to both of us so we don't miss it. Actually, it's March 27th. March 27th, and it's here in Sacramento. And I'm not sure if, like you said, there's one in LA or not.
Yeah, I think they're working on it.
Okay. All right. The board training, if you get reappointed or you're new, you have to go. Or no, it's not annual. It's your reappointment or if you're new.
Yeah, it's within 1 year of appointment or reappointment.
And there is one here in Sacramento on March 27th. Also, on that account, what I'd like you to do is for the sexual harassment and for the, what was the other one you can do online? Oh, and the 700 form, just in case. If you just send out the links to remind everyone, that would be great. Like if there is a link to just go to do the training. I think that would be, if it shows up in an email, we might click on and do it, okay?
So they don't send out the same emails to board members that they do to all employees? Because I really don't know. Because I get one that reminds me to do my Form 700 and to do my sexual harassment training and whatever other trainings are due that year. So is there a way that we can ask for that so that you guys don't have to, well, anyway.
Well, I've already gotten an email alert for the form,
I got an email alert for a form, I think, as well.
so it was an automatic.
But I don't think haven't seen the sexual harassment one come up lately. So,
We'll get you the link and we'll get you plugged into
right, I just think it's,
It's usually towards the end of the year for the
Right.
harassment one.
okay.
A question about the calendar for the day at the legislature. Is this the appropriate time to ask if there's been a decision made if more than 2 board members can attend that day at the legislature without violating the?
Yeah, and actually I got an email from Brian about it, and I do have an answer for you, but since it's not on the agenda, we can talk about it later. But I mean, I'll tell you, I'll give Brian an answer and he can respond to you. But yeah, the answer is yes, you can.
Okay.
And that day is, Dr. Zaff, is it April 3rd? Right, April 3rd, CPMA Legislative Day.
And just to confirm, we are planning to host a board member orientation training in June in Southern California, location to be determined.
Nice, I think everybody from Southern California on the board's already done it, but there you go. But that's good news. I know that would help out a lot of people.
And our travel expense.
So that wraps up our licensing program. Our next up is our enforcement program update and possible action, and Dr. Mansforth, turn that over to you.
Okay. So this looks at our enforcement statistics over the past quarter ending December 31st, 2018. Complaint data, we had 37 complaints received, which was a 19% increase over the second quarter last year. Average days to close was 9 days, and we always seem to be in compliance. Very seldom have we ever fallen out of the 9-day requirement.
It's now
And
10
now-
days.
And now it's 10 days,
Changed
so
to 10 days. We got one extra day now.
the one thing we've always
Right.
complied with, they've now extended the time on, not the other ones. Okay, investigation data. We've had 37 desk investigations assigned, 41 desk investigations were closed. That's a 122% increase over last year. 6 investigations were assigned to the field, which is the same as last year, and 5 field investigations were completed, which was a 32% decrease. Average days to complete investigations was 136 days, which is close to the 125-day requirement. We're usually pretty close to that. Disciplinary data, we had 2 cases initiated with the AG's office, and 1 final order went into effect. No citations were issued over this past quarter, and no changes to the probationers. We have 10 active probationers currently. For enforcement statistics, attachment D, you can look over the individual statistics. On a monthly basis, they're so highly variable that I think the most important thing, most valuable data I see is the annualized information comparing 1 year over the next. So you're welcome to look that over. If you do have any questions, please ask me or Bethany. Moving on to Section E, Attorney General Case Aging Data. This is through January 3rd, 2019. There were 3 cases forwarded, but only 2 accusations were filed, and 1 final order was sent, as mentioned. We have 11 cases pending, so that's actually on the higher end for us, and that's a big expense. Let's see. And we still have the 2 non-administrative mandate cases. I think it'd be really helpful if you wouldn't mind talking to Dr. McAloon offline and getting her up to speed on what these cases are. It's something we don't typically have, and it's going to come before us again. On attachment E, you'll actually see there's 3 cases that should be coming before us soon for a board vote, so those should be falling off. We'll only have 8 pending cases. DCA performance measures, well, much like fiscal, the performance measures we don't get either. This is the government we have and love.
The data tool did just launch.
Oh.
However, enforcement data is not yet available, so it should be coming soon. I'll
Okay.
report on it when it does.
So maybe in the next report we'll
Thanks
have
for
our...
taking this, because I'm coughing a lot today.
Oh, no problem. Okay, so hopefully we'll be getting that in March. Number 2, update on BPM use of vertical enforcement. And this is actually important, so I'll read this. After discussion with the AG and Division of Investigation, the decision has been made to discontinue vertical enforcement as the other medical boards are doing. We may still request assistance from the AG for interim suspension orders, subpoena enforcement petitions to compel examinations for potentially psychologically or physically impaired DPMs, and for deputy attorney assisted investigations on a case-by-case basis. Investigations that may involve the AG are likely to involve sexual misconduct, drug abuse, or prescribing issues, be particularly complex, or contain multiple extreme departures from the standard of care. So we're not the only board who's contemplated this. It seems to be rather expensive and wasn't necessarily a requirement for all the cases, so it does make sense for us to use it judiciously, and we can anticipate some cost savings by moving or to using the AG's office in vertical enforcement when appropriate.
Yes.
I don't know if you want to add to that.
Vertical enforcement was never a requirement for our board. It was a requirement for medical board, but we tried to do what they did, and so we went along with the vertical enforcement. They've had it taken out by law. It's no longer required, and I think we're all going to see a big cost savings with this, and also maybe an increase in the speed of investigations. So hopefully that's will be the result.
I do have a question. Off the top of your head, like how much money did we spend in the last, I don't know, year, 2 years, whatever, on this type of thing?
Honestly, I would have to take all of the reports and try and figure out a breakdown as to when the cases actually were transferred to the Attorney General's, transmitted over for filing of an accusation, and how many hours they spent on the case, discussing with the investigator, our board, prior to that. It might be kind of difficult to obtain. Maybe I could get it from the AG's office. Maybe they would have that available. But I can ask.
Are you talking like $10,000 or like $50,000? I mean, do you have any idea?
I mean, AG costs are fairly high. Their hourly rate is high. Way more costs are going to be after the accusation is filed, because they're putting the bulk of their work into that. So it might be a few hours per case prior to that. But every single case that goes into field investigation, which maybe is 40 plus a year, we have an AG assigned, and they're going to be discussing with the investigator at certain points, sitting in on the interviews. So that's several hours of time per case. Whereas the investigators now can just do their job, not have to constantly get feedback from the attorneys, complete the case, wrap it up, and then say, hey, now it's going to the attorneys for them to do their portion.
So it's more like a traditional law enforcement investigation where you have a detective, right, that takes the case and then submits it to the DA, right? Rather than having the DA work alongside that detective where it doubles the cost.
We'll know this upcoming year probably what we see with our cost savings. So.
Thank you.
Moving on to item number 3, probation program update. Thus far, we've received about $13,000 for probation cost recovery and monitoring. This is a little lower than usually expected, around $30,000, and that's due to the invoices going out late. Hopefully, we'll see that recovery come in later in the year.
We're already seeing a higher third quarter than average, so I think
great.
we'll see that made up.
Thanks.
next report.
Item number 4, podiatric medical consultant applicant. We've had Dr. David Liss apply as a medical consultant. He meets all the criteria to perform the duties of a consultant. My only hesitation initially for Dr. Liss was he's young. He's been in practice since 2014. But I will give him some credit for being young and energetic and wanting to help the profession. And I also trust Bethany, who's been doing this long enough, for good oversight of our experts. And if she sees something, I suspect she would actually have him consult with some of the other experts that we utilize for the board. So given that, I would actually make a motion to move that we accept Dr. David Liss as a podiatric medical consultant for BPM.
Michael Zaff, second.
Okay. We have a motion here to,
Dr. Manzi?
Oh.
Are we calling the vote?
Is there a discussion?
Dr. Manzi?
aye.
I think the last one is their discussion.
No, I mean,
You have to ask, is there?
Right.
yes.
So we have a motion here that, to approve Dr. Liss being a consultant. He is residency trained, and he does meet all the requirements. I think it's a good idea to have some younger people in the pool. Is there any discussion besides what I'm about to say?
So my question, to Neil's point about him being a fairly new physician in the field, is there an opportunity for him to be mentored by one of the more experienced individuals?
I could certainly present that to the other consultants to see if one of them would like to take it on. I don't know if they'd want to do it, free, or if we'd be paying them their consultant fee for that.
I mean, I think that could be something for the board to consider.
Mhm.
I mean, one of the things that we've been talking about is expanding the consultant pool. And in an effort to get more younger physicians into the fold, into the pipeline, I think that could be an added opportunity, especially to use the consultants who are more experienced, to maybe move into a more mentoring role with the younger physicians.
Yeah, I do always provide them an opportunity to speak with experienced consultants, and give them contact information so that they have questions as they're doing their work. And but yes, that's a good idea.
Because right now it's an option, but what if it's a requirement, right? Like, we're accepting him with condition that you be mentored.
My only concern there would be requiring the other consultants to mentor others on top of their already busy schedules.
I think he should, to this point, it's a good point, okay? When you get your first one, you're sort of like, oh, am I writing this right? Am I doing, they get some sort of training. But I also think that we need a really broad kind of pool. I don't know, what his scope of practice is. Some podiatrists do some things and some do others. And I think that, when we are getting a complaint, it'd be nice to try to match that complaint with someone who maybe could have some experience in that particular complaint. You know what I'm saying?
So this is what I do now. I sent out a survey to all of the consultants and experts to get their specialties. So I have that information compiled. Also, when I assign a case, I give them a little bit of information on what the case is about. So whether it's ankle surgery or whatever type of repair was done, that way they can determine if they have experience in that area and can do the review. If they
Perfect.
don't, they shouldn't be doing the review.
Exactly. And I think as far as mentoring goes, as far as the writing up of it, I kind of agree with you. But I think as you write these, you get better at them. But I think as far as the look of what's gone on in the case, you have to trust in some way that a person that is newly trained like he is, and he's newly in practice, and he's successfully gone through all his training or passed it, is very up to date and maybe even more current on the expertise that is required. Because I know just from my residents that come through, they would be in their third year, they would be pretty good resources. I mean, I can say that very confidently. as far as understanding what would be, standard of care.
And we do provide the annual training. They have to come to at least one before they get started, and then every 4 years after that.
And just looking at, the discipline that you provided it's not our ones that are right out of getting their licenses. I mean, they're on top of it. So, they're in this field for a reason. So I think I welcome having a younger physician on board, so.
Are there any?
I just had just as a new member and not being familiar with this process in particular. So it says that there are guidelines. So I don't feel comfortable voting it because I don't even know what those guidelines are. So I don't know if there's access. I mean, for future reference, access to what the guidelines we use to pick consultants would be helpful for me because I don't know what they are.
And I'm sorry, I didn't attach them this time in the report. I normally do.
That's
was
okay.
Part of the committee meeting.
The board.
Fair enough. I mean, because
It
I
is?
think so.
Oh,
Oh,
it's
not in
in-
this packet. No, I think in the initiation packet that the new board member has. Yeah.
okay, I haven't gotten that.
Oh, okay.
No, that's okay. I just wanted to inquire a few questions just in being lack of educated on this. So you were saying that, let's say that, for example, it's the complaint is regarding care of a diabetic wound versus an ankle reconstruction. You're going to ask that that consultant, is your education training experience qualify you to evaluate an ankle fracture versus a diabetic wound? And they'll tell you that's my purview or not so
yes.
much?
I recently had a very complicated case, very complicated, and one of our very experienced consultants, or actually experts, returned it and said there's stuff in here that I don't have experience with. So we had to find another individual. Most of the information he did have experience with, the stuff that came up, and he's like, I can't review this case. So it happens occasionally, but normally we're able to find somebody in advance that already has all of the experience.
The experience and to speak to whatever that issue
Yes.
was. So that's helpful. So we have an internal stopgap to help make sure that someone's qualified to review that particular case.
Biggest issues
Yeah,
I would
that's
say
right.
I run into here with finding experts and consultants is we have a very limited pool, not a lot of them, and so a lot of them know each other.
Mhm.
So finding someone that doesn't know that individual and also has the right experience.
Oh, so you also have to be blinded. You have to not know the person who's getting the complaint?
Right.
Oh, okay. Yeah, that's hard. We only have
know
2,000
them. You can't-
licensees.
Conflict of interest is if you have like a personal relationship, if you work with them, something that might cause a biased review.
And so I'm assuming there's no, and in the requirements, that the criteria, it doesn't say about how many years in practice you have to be to qualify you for that, because that would come up on this conversation.
Right.
I hear mixed opinions whether it's an issue or not. If we wanted to add, you have to be in practice 5 years to, but like you said, we're limited, so do we want to tie our hands that way? It doesn't sound like a good idea either.
You have to have board certification, so that's on top of your license.
Mhm.
You have to have no open investigations within the past 5 years, no disciplinary action. There's, other requirements that we use. So number of years of experience is probably important, but
I do think, though,
Thank you.
Dr. McClune, she brings up a good point, and I always wonder about this, too, especially since you made that other report about what disciplines we've seen. And honestly, if I think futuristically, the scope of practice for podiatric physicians in the state of California has changed a lot. And I do believe that take away the disciplines that might come up because of drug and alcohol abuse, because unfortunately that seems to be never going away. Or, we'd like to think it would be, but insurance fraud and these kinds of things that are like, I hopefully we're not going to see a lot more of that. But I think that, the scope is different, and I think the cases that are going to come before for disciplinary action as the scope increases is going to be far different than more along the lines of people feeling something was negligent as opposed to some of the other things we've seen. So I do think it's important that we do get some people on board that are actually doing these things so that the standard of care within the community is understood by the person who's reviewing the case. So with that being said, does anybody have any more discussion regarding Dr. Liss?
Also, ask for public comment.
Oh, yes. Is there any public comments? Thank you. Okay. Does anyone have anything more to discuss in regards to the appointment of Dr. Liss. Okay, so we have a motion that we have a new candidate to do review for us as an expert witness, Dr. David Liss. And we'll now take a vote.
Dr. Manzi?
I'm in favor, yes.
Ms. Elliott?
In favor, yes.
Ms. Cardenas?
Aye.
Ms. Dixon?
Aye.
Dr. McAloon?
Abstain.
Dr. Mansdorf?
Aye.
Dr. Zak?
Aye.
Thank you.
Okay, so that motion carries, and Dr. Liss is now on our list of potential helpers. Okay.
Okay, moving on. This carries into the next item for discussion about increasing expert witness hourly pay. Because one of the reasons why we don't have a lot of experts or consultants is they're not getting paid a whole heck of a lot. In fact, for years, Medical Board has been paying their consultants and experts $150 an hour. We've only been paying ours about $100 an hour, at most $125 for unique cases. So after doing an analysis, staff had done an analysis to determine what our additional costs would be if we increased it to try and match Medical Board. And there's attachment G, which shows about an estimated annual overall increase of $6,200 a year, which honestly I think is worth it. And as a little aside, MBC is actually considering increasing their pay to their consultants and experts to $200 an hour. I think it's a little premature for us to do that, certainly until Medical Board does it. But I would make a motion that we increase our pay for our experts to $150 per hour.
I'll second.
Okay. So we have a motion to increase the pay scale for our expert witnesses to $150 an hour. All in favor?
Is there discussion?
Oh, any discussion? Any public comment?
Let's do discussion first.
Any discussion?
Okay, you'll get it.
I think this is a good opportunity because when we're at the Western, we try to recruit as hard as we could, rather than throwing fishing hooks and pulling people over to us. But the one concern I was pulled aside to is we're not paid enough for the work that we're doing, so I'm not interested. So that's the driving force, and I said, I need to entertain this. I need to bring this before the board. We did get a temporary increase of $200, and this is why I'm bringing it to the board now. I did run it by our budget guy, Carl, and he doesn't see this is going to have any adverse effect with us, $6,200 possibly increase. So I'm pretty comfortable with this going through.
One thing I would say, though, is I don't know that we need a huge pool of people, but I think we need a diverse pool of people, and a diverse pool of people across the whole board of, not only sex, gender, age, but also expertise. And, you can just glean from who's practicing in California, who's doing what, who's doing the most ankle joint replacements, who's doing the most. And is there anything wrong with targeting these people to actually invite them to please be an expert for that particular,
if I had a list of those names, we could certainly try to get them on board. They'd have to go through the process first of being approved by the board and then getting trained, which could delay a case by many months. And they're probably getting paid much more as experts by the courts.
Right.
But
Are we aware
certainly
of
worth
any
a try when you
holes
need
in our expertise?
I don't know. When I read the reports, that are given to us, I think our experts do a good job of picking out what was wrong here. So I haven't seen that at all. I'm just thinking ahead because honestly, I don't, I know some who our experts are that come through, and like she says, if they send it back and say, hey, I'm not that, I don't do that much of that, have someone else review it, that's starting to become an issue. And I just think that will be the issue.
it's happened one time
Right.
recently.
Right.
That
Let's say a case comes up on a specific area. where no one's really an expert except one or two people who are not experts. Can we facilitate their approval process if we had to do that?
I send that question to legal.
I mean, could we,
So in other words, you get a case and you say, oh my God, so-and-so should review this.
somebody did a
Not an
toe
expert
transplant
witness,
that
can
went
we
bad.
Would the other person being recommended also be already a consultant with the board? No.
We're
Okay,
saying that we
that
know-
person, I mean, you're more than welcome to, as a consultant, make a recommendation to your colleague to seek out opportunities with the board for consulting, but you cannot give them the file. No. That person needs to be an approved consultant by the board, and so I would say they would need to go through the regular channels to become a consultant. And then if they're already a consultant, then you could tell Bethany, hey, Bethany, you know what? I know so-and-so is also a consultant with the board, and I think he'd be fantastic for this. He has the right experience, right background, whatever, and then go that way.
But
But
that wasn't-
otherwise,
The
no, I
issue-
would
But
not
you
give
can't
it.
That wasn't
expedite
my
it
The
because
issue
you
would
need
be
the
is you
training.
guys wouldn't be seeing the case during
First.
the investigation
Right.
phase anyways.
Right.
You can't see it until it gets to.
But we can see our list of who you've got
Yes.
as an expert witness.
Yes.
Like you have, how many do we have, do you know?
You know, we've lost a lot over the years, so we're down to about 11 consultants, I believe.
Oh, yeah, we
And
need to
I think
increase
only
this.
22 active experts. We definitely need more names because some of them rarely take cases. Some have never taken a case on our expert list, actually. Our
May-
consultants are busy, but
May I suggest that this seems to be a discussion around expert pipeline, and it's been addressed partly, if this motion moves forward, in pay, but questions have been raised around the makeup of the demographic of the pool, the type of outreach that could be done, and maybe even data sources of names for potential candidacy. Maybe this is something that the enforcement committee could review and bring back to the board for the next meeting for discussion.
I agree.
yes.
I agree. I think it's important.
Recruitment is needed, so.
And I think it should be, like I said, a diverse recruitment that addresses scope of practice as well as gender, age, sex, everything.
And Dr. Manzoff, when you do that, can you also put in there a difference between an expert and a consultant?
Yes,
Sure.
Thank you.
absolutely. Good idea.
That's also in your introduction.
Oh, okay,
packet,
great.
too, when you're introduced.
I think too, we can also reach out to CPMA for their help in advertising those pool of your members.
Like to call for the question?
Okay. Did we already take a vote? Oh, can we take the vote now? Yes.
On the 150 per hour.
Yes.
Dr. Manzi,
Aye.
Ms. Elliott,
Aye.
Ms. Cardenas,
Aye.
Ms. Dixon,
Aye.
Dr. McCallum,
Aye.
Dr. Mansdorf,
Aye.
and Dr. Zab.
Aye.
Thank you.
Okay.
One final question, does that mean that goes into effect today? The increase in pay?
You could probably send out the email and make a lot of people happy today.
Good idea.
Well, I would recommend that the motion be amended to include an effective date.
Okay.
So, sorry, you want to vote again?
I'd like to amend that emotion that it's effective today, the increase of $150 for our expert witnesses. You can,
I'll accept the amended motion.
Dr. Manzi,
aye.
Ms. Elliott,
Aye.
Ms. Cardenas,
Aye.
Ms. Dixon,
Aye.
Dr. McCallum.
Aye.
Dr. Mansdorf,
Aye.
and Dr. Zab.
Aye.
Great. Okay. With that being passed.
I just want to say it was a really good job with the enforcement committee to bring this up and bring this forward.
Good job.
I think this is a really good opportunity for retaining and recruiting these expert and consultants. So, nice
agree.
work.
Good job.
I'd also like to thank Bethany for the work that she does and for putting the report together. Thanks.
Thank you, Bethany. Okay, we're going to take a 5-minute break. Okay, is that all right? Yeah. All right, we're going to take a 5-minute break, and we're going to rejoin here in at noon. It's a little more than 5 minutes. Okay.
Thank you.
I love using this thing. Here we go. It's the best part of the job. All right, let's bring our board back to our we're going to continue our meeting now.
She's allowed to relax and just kind of tell me if I'm doing something wrong.
When do you want to do that? Okay. Skills. Okay. How about when I get to public education? Okay. All right, here we go. So, Dr. Zaff, you're up. We're going to discuss the legislative program update and possible action.
And I'm going to bring my partner in this, Kathleen.
Good morning, Dr. Zapp. Good morning, everyone.
And we're going to talk about the legislative program update first. Kathleen.
Okay. Good morning. This is the legislative report for March 1st. And I would just like to say, by way of introduction, there's 2 items here that we need help from the board or action from the board. The first one is the implementation of 2138, which is the prior criminal convictions that will affect licensure. And then AB 2457, we need some movement on that for the regulations to be presented to the Office of Administrative Law. And those are to implement the name change. Very simple and straightforward. Okay, so I'll start with AB 149, which was addressed by Mr. Ryan Spencer. And this bill is simply in relation to 1753 of last year, which gave a deadline for the prescribers to be able to get a new prescription pad, which wasn't available by the assigned printers. There's only so many printers that can print these serial numbers in order, and just logistically it couldn't happen. So 149 addresses that and delays it 1 year. Any questions or comments on 149 and 1753? Okay.
No, because isn't that now going to be extended till January 2021?
It is.
Okay.
So you
Does
can
everyone
just
know what that is? That's your triplicate forms. Okay.
Yeah, that's, the 1753 was the bill that, it was, I believe, 2 days before Christmas that we got the shotgun implementation that has to be done by January 1st, 2019. And so again, I want to thank staff for really making the effort to make that happen and trying to inform all the licensees and stakeholders of what was going on. So now we're on standby. So that's usually what happens is you pull the trigger and then you have to go get the bullet, I guess.
Okay, so 149 and 1753 just seem to be business as usual. Everyone will write their prescriptions as normal throughout this year. Okay, so the legislative calendar, they call it the tentative legislative calendar, but I've never seen it changed with all the deadlines for the year. It's just there for your convenience. If there's no questions on the legislative section, I'd like to go to something more important to us right now, which is the regulatory section.
And I'll just bring up to everybody that since the bills were introduced, that was last Friday, we're still going through with our legislative analyst and finding out what bills are pertinent to this board. So there's still a good work effort on that. As soon as that comes out, I will email those to you just so you're up to date of what bills that we will be following. There's a couple that we know of right now, but we'll have to see what else is going to come out.
So I just had a comment. When we were talking about we got the legislative overview by the legislative analyst, there was discussion around the legislative day. So I don't want that to be lost outside of this conversation, because that was really what came up in our legislative committee. So being that it is a broader legislative day, will there be any information or communication to board members who want to participate in that? And then will CPMA be coordinating, putting people in touch with, because usually when you do a legislative day, you don't go and do advocacy to the different assembly members and senators. So will that be coordinated by you? Will you put people who are interested in touch with CPMA? Like, how will that work?
I'm going to defer to Brian on this.
I know there's going to be 3 DPM board members going, right? Or 4?
I'm a maybe.
You're a maybe. So what we'll do is can we coordinate with you? Okay, and then get the information out. I know it's on your website of what day it is, and I think everybody needs to register. Is that correct?
Absolutely, by March 18th.
But is it only excluded to DPMs, or can public members attend?
Public members are welcome, as are students.
So I don't know if any public members would be interested in participating, but I definitely don't want public members to be excluded from the opportunity to be able to go advocate on behalf of the board.
Right, so we'll get that information to the public members. And also Ryan Spencer, I think he's setting everything up, and I think he has a pretty good agenda, maybe including the governor, I understand, might be there.
Okay.
So it might be worthwhile to take a visit, but we'll get that information to you.
Perfect.
If public members do wish to go, please register, because the CPMA will set a meeting up with your legislator. So that,
So you'll get that information to the public members who aren't a part of that loop right
Well,
now?
it's on our website. I don't know.
Okay.
Yeah.
How that gets out to the
I'll get a
public.
hold of Althea, and we'll work it out. We'll make sure you get all the information.
Perfect, thank you.
And I can make one more comment. When you register, then Ryan takes that information and connects it with your constituents, so you will be meeting with the important person in your area.
Perfect, thank you.
Okay, that does it for legislation, and we'll go to regulatory actions. We have received some language, and legal will be addressing this for you and handling this item, but DCA, along with the Department of Justice, provided all the board's language that we need to implement at a date certain toward, right before June, I believe it is. We have to get that reg in so that by next year, we give them enough time to implement the reg and get it into the regulations. Option 1 was chosen, I believe, by the committee, but they can address that. It gives you more discretion in reviewing someone's application and their criminal record. And option 2 seems to be more black and white. If this, then that, and you won't have too much discretion. But at this time, and I apologize for the attachments, they got a little confused. Please, the report refers to attachments, but this has been updated, and I think you'll find it straightforward when you get to the attachment. The one you're looking for is the new language. I believe it is now G. So, Ileana. or
Kathleen, I don't
legal?
think the committee chose an option.
No, and
I had written down that option 1 was a preference.
I'm going to walk you guys through it. She's just giving you a quick summary.
Right. Because we were split.
Oh, yeah, and the board will definitely be discussing it today, and that's not being taken away from you.
Ileana? Okay.
Okay. Yeah, I just wanted to have Kathleen do a quick summary for you guys so you know what the general topic for discussion is with regard to the regs. So if you look at we're on agenda item C2. A is 1399.659, and that's probation and reinstatement of suspended or revoked certificates. So that is your attachment D. It looks like, I want to say at the bottom, it looks like page 27 for me. Anyway, let me know when you're all on attachment D so we can all be on the same page together.
Should be the new packet you guys have.
Oh, the new packet, it's not in our, it's this one. Doesn't change.
Oh, it's G. Oh, okay, sorry. I just updated my own pages and didn't use the new packet. Sorry. Let me get to that.
Attachment is page 28. Attachment D.
Or she wants 28.
It is attachment G now. Hang on.
She's going straight to the language, so it is G. Okay.
It's page 55. I made my own changes to my binder when I got it, knowing what needed to be there, so I'm not using the same. But it's the same content. It's just different numbered for me. So you should be looking at Article 1, 1399.659. Maybe all there? Okay. So this first one is for the substantial relationship criteria that needs to be updated to implement 2130 AB 2138. And so basically, I believe that you may have, let me just double check. Okay, so you only have the one draft in there now, good. Okay, so the one that you have, basically, why is that? Hold on a second, sorry about that. the version that you have
Would it be 53, page 53 and 4
yeah,
and 5?
sorry. I thought I had a different one in my binder. Okay. So you're updating this to reflect the changes in, sorry, I'm just trying to get on the same page with you guys because I'm not using mine anymore. Okay, so 13, this reg, sorry, let me back up. This reg has, is changing the probation and reinstatement of suspended or revoked certificates. Currently, this regulation points back to the medical board's regulations, and since you guys are now separate from the medical board, you will need to have your own regs for this. So so we just made the appropriate adjustments so that when you have new regs that you're creating on your own, you will only be using what's left over from the medical board's regulations. So basically, until you guys can have your full regs on your own, you can still refer back to the medical board. So you're not without regs for a little while, because that would not be okay. So that is what this reflects, and I'm sorry it was such a jumbled mess for me to explain that to you.
That's fine.
And if you look at the comment on the side where there's a bubble comment and it says 2487 was repealed in 1992, that is just a cleanup. So when this reg was initially done, it had a reference to 2487 in there, but since that statute no longer exists, just as a cleanup, we're going to take it out. And I think it's cleanest if we go through these one by one, and either you can make a motion at the end, or you can make an motion by each individual reg to go through and make the adoptions or make any amendments that you want to do. So now that I've hopefully not confused you, does anyone have any questions?
No, but I think it'd be better to go through each of them separately. So the first one is the probation and reinstatement of suspended or revoked certificates, correct?
Yes.
Okay. So does everyone understand what she's talking about? Okay, great. So just
Okay.
make
So,
this, go ahead.
so is there any, you can either do the motion before or after, but is there any public comment about this language? No? Okay.
So this is for section 1399.659, which is probation and reinstatement of suspended or revoked certificates. Motion to approve the proposed regulatory amendments to the section 1399.659 of Title 16 of the California Code of Regulations, probation and reinstatement of suspended or revoked certificates. Direct staff to submit the proposed text to the Director of the Department of Consumer Affairs and the Business, Consumer Services, and Housing Agency for review. And if no adverse comments are received, authorize the executive officer to make any non-substantive changes to the rulemaking package and set the matter for hearing. All right? So all,
Well, do you have a, is there a second?
that's the motion, so.
Jeff moves that motion.
Okay, that's second, Dr. Zapp. All right, so now we'll take any
More
discussion
discussion and public comment, yeah.
and public comment. Do you have something to say? Darlene?
Ready for vote.
Okay.
Ready for vote.
I guess I just want clarification what we're voting on, because there's a lot of changes in attachment G.
Yes.
Are we doing all the subsections, or just doing
one.
just one subsection? Okay, just want to be clear, because
Just
the
the-
number that was called out was for the entire article, and there's subsection 1,
Yes,
subsection 2.
so we're going to do them separately. So the first one is just not the .1 or the .2 or the
So just a change in the
probation
in
and
the-
reinstatement of suspended or revoked certificates.
So
Yes,
just
so-
that line.
Yes,
Okay.
so attachment G has 3 regulations in it. You're only looking, right now, this motion is just for 1399.659.
Okay,
Does that answer your question? Okay,
so that's page 55.
That's right.
correct.
Okay, thank you.
Any other discussion or public comment? Okay. If not, we have a motion and it's seconded, so we'll now take a vote.
Okay. Dr. Manzi?
Aye.
Miss Elliott?
Aye.
Ms. Cadenas?
Aye.
Ms. Dixon?
Aye.
Ms. McAloon?
Aye.
Excuse me, Dr. Mansdorf?
Aye.
And Dr. Zapp?
Aye.
Thank you.
Okay, so that motion carries. We're now going to go on to section 1399.659.1.
Yes.
which
And
is
this one is for substantial relationship. Also with the adoption of AB 2138, there is a requirement that, that the board evaluate and basically rejigger its substantial relationship criteria. And this proposed regulation does that. And if you look at the first comment bubble where it says tracks medical board reg 16 CCR 1360, that is just a comment noting that it looks the same as medical board's regulation. And then also Tara would like to know, and I would like to know too, if you want to include any additional articles. So if you look at AB 2138, it has, and I'm sorry that I know this is confusing, you guys are not attorneys. So basically, this reg indicates that for the purposes of denying, suspending, or revoking a certificate, it determines that a crime, professional misconduct, or act will be substantially related to the qualifications, functions, or duties of a podiatrist if, to a substantial degree, it evidences present or potential unfitness of a person that holds a license to perform the functions that are authorized by their license, consistent with the public health, safety, or welfare. And then it has criteria that the board considers in making this determination. So it looks at if the crime is, you look at it, the nature and gravity of the offense, the number of years that have passed since the date of the offense, and the nature and duties of the person holding the license. So those are the criteria the board would consider in determining whether something is substantially related. And those three criteria are found in the statute. 2138 says you need to put these in there. So we've done that for you. And then if you look at letter C, in terms of determining whether something is substantially related, professional misconduct or an act that is substantially related, you look at the following criteria, and it has whether someone has violated or attempted to violate directly or indirectly, or assisting or abetting the violation of, or basically having anything to do, if you had anything to do with violating the Podiatry Act or its regulations, that would be a substantially related crime, act, or misconduct, professional misconduct. For example, if you were licensed in another state and you committed these acts elsewhere.
So just, I'm not as familiar with all the regulations, but when you're saying that if we should consider including other articles besides 12, 22, and 25, were there some that you were thinking that we should be looking at?
Yeah.
So I'm just going to pop in here because that was
Absolutely.
my comment.
Fine.
Right now, it currently lists the articles and sections to both the podiatric medicine law, but also the medical law, because DPMs are subject to both. So right now, it lists all the relevant articles where those statutes sit for both under the Medical Practice Act and also the Podiatric Medicine Practice Act. I just wasn't sure if you wanted to include some more, and these are all under the Business and Professions Code. That's what these references are to, articles under the Business and Professions Code. So I try to just include everything that I could find that related to DPMs.
So if there's anything else that you think that should be included but is not, then this is your time to let us know that you would like to add those things. So if you think that there's anything besides what's in Article 12, Article 22, and 25 of the Medical Practice Act, and those are the enforcement portions of the Medical Practice Act, I can get those out.
I guess just for a point of clarification, I have
Yes.
no idea what's in Article 12, 22,
Right,
or
and
25, so I
exactly,
can't
so-
comment to that,
Right.
nor am I familiar with the other articles that may be
Absolutely,
considered. So I'm
100%
relying
agree
on
with
you
Yes,
to inform us.
absolutely. Hang on 2 seconds.
Okay.
Well, I have a comment, though.
Of course.
I understand that this is no different than what we've already been operating under.
Exactly.
It's just we have to now operate on our own pieces of paper because essentially we've split off from the board.
Yes, and it coincides with this additional requirement of AB 2138 to say, hey, by the way, we want you to redo your substantial relationship regs. Because right now, you are using the medical board substantial relationship criteria. They have their own practice act, which you guys are also bound by to a lot of, I'd say about half of it also belongs to you. And because you've been part of the medical board for so long, there's a lot of regs that you guys don't have that are specific to your board. But now that you're separate, you will need to have those specific regs to you. But it just happens to be good timing, I guess, if you want to be cheeky about it. Good timing that you guys are no longer part of the medical board, but also AB 2138 came out at the same time saying you need to update your substantial relationship criteria. So now you're going to develop your own reg. So you're not going to be borrowing from medical board anymore. So you'll have your own reg. And then when you develop your own reg, you will also be compliant with the new requirements set by 2138. And I will go through with you right now the those articles that we were talking about.
And just before you do that, what I'm hearing is that what's being presented to us and the articles that have been pointed out, Tara, is the ones that you identified, and that they track or mimic the ones that are existing in the medical board. Is that, am I understanding correctly?
So, it does not specifically, I mean, this part doesn't track the medical boards. Because we had to add additional items to incorporate not only your particular laws, but then also the Medical Practice Act laws
So
that
then it,
apply to you.
so then it includes the medical boards in addition to those other ones that apply to us?
Podiatric medicine,
Okay.
yeah.
So it's a little more extensive than what the medical board is.
Right, but also, the medical board has to update their substantial relationship criteria also. So it's not just, oh, we need to separate ourselves from them. They have to do their update, and now we're going to do a separate update, which is beneficial. Instead of relying on medical board, this board is about to go through sunset review. And potentially one of the questions you may be asked by the legislature is, how are you implementing 2138? And now you are. So not only are you implementing that bill, but you're also starting to separate your laws from the medical board.
Thank you. All right.
So, just a quick question or clarifying question. So, is this something that has to be taken now? I mean, this is the time frame where we don't have a choice? This is the only bite at the apple we get?
No, well, okay, so yes and no. So it would be lovely if the board could make any changes and finalize this today and move it forward so that you guys can start the rulemaking package. However, if you think that there's some changes that need to be made, by all means, it would be lovely if we could make them today. If you think that you need a little bit more time, because of the start date of this bill, with the effective date of the provisions, it's July 1st, 2019. In order to get is that right? 2019?
2020.
2020, I'm sorry. There's something else that starts July 1st. It's your name change. Anyway, in order to have the reg adopted in time, the reg language needs to be approved in March. So in theory, it would be like I said, it would be great if we could do it at this meeting. But if it doesn't happen in this meeting, it's very possible that you will need to schedule another meeting before your June meeting to further discuss this. So if that means potentially schedule a meeting 10 days from tomorrow so that it can have enough time to be noticed, so you guys have more time to think about it. But I don't want to say you have to do it because no one can make you do anything. But in order to meet the timelines and to have regs in place in a timely manner, and also to tell the legislature, yes, we've done this and we've been timely about it, I highly recommend that in March that this gets approved, and hopefully at today's meeting. If not, we'll just have to schedule another meeting, and that's up to the board.
Okay, so listen, I just want to understand that had we not split up from the medical board, we wouldn't be having this discussion. We didn't, true?
Agreed.
Okay.
Because the
and-
medical board would have been doing it, but then you would be bound by their regs.
Exactly. And I don't know that I've heard any burning reg thing that we wanted changed.
I don't think so either, but again, it looks like one of the board members does have a question about what the articles are, and I'm happy to
Right.
walk those, walk through those.
So that would be my concern. I think the concern is there's a question, do you want to include additional articles, right? And so given the time frame, given the importance of this regulation for BPM as a standalone board, I think what you're hearing from the board members is we don't know enough about what else should be included. And I personally would not want to be rushed to put out a regulation that may have things that we may have excluded, things that we could have included or should have included based on a broader scope. So, I mean, if we can get through that today and find out if there are additional, I mean, maybe this is the exhaustive list, maybe it is all encompassing, but to Maria's point, I don't know.
Absolutely, and because I didn't know that I was necessarily going to be the one presenting it, I would have prepared something a little bit differently. But I'm happy to explain. We can have whatever discussion you'd like to have. So basically, Tara, she did the initial draft of this, and I also put my eyes on it. And I looked up every single thing, and I basically went through, because, the Podiatry Board has its own practice act, but then there's plenty of provisions in the Practice Act that point back to the Medical Practice Act, because, you guys have the overlapping statutes, right? I cross-referenced, and so did Tara, all of the things that you guys have to do with enforcement that are from the Medical Practice Act, and everything that's in your own Practice Act that says, this is how we do enforcement, these are all the things that you need to look at. In my opinion, well, frankly, I would have told you if there were other things that I think that are missing. So, I know you don't know me, but I feel like what needs to be covered is covered, and it looks like Tara has something she'd like to add.
Okay, so my comment seems to be raising a lot of concern here. My question was really to Ileana and Brian when I was initially drafting this. So I did not control what was actually included in this package, but I can tell you that Article 12 is the enforcement provision under the Medical Practice Act. Article 22 encompasses all of the podiatric medicine statutes. And Article 25 is the medical cannabis provisions. We have both looked at the Medical Practice Act and determined that these three articles are sufficient to be included to effectively nail down what is substantially related conduct. So any violation under these articles, these three articles, should be sufficient to cover any improper action of a podiatrist who is currently licensed or applying for licensure. I also want to mention that I've got a minor technical change on subsection B, paragraph 3. It says the nature and duties of a person holding the license to be consistent with the term certificate used above in subsection A. I'd like to change that to change license to certificate. So otherwise, these three articles we believe cover podiatrists effectively. In the event that there's one other article that we determined should have been added through the rulemaking process, if it's determined that it's a minor technical change, when you delegate to the executive officer by vote of this rulemaking package, he could make the change and it wouldn't have to come back to you. We definitely are aiming to be as inclusive as possible.
So I would like to add also that my intention with all board meeting materials, especially when it comes to regulations, I would like them, I bring them ready to go. And in the future, I will absolutely prepare something so that we don't have to go through this again. So that you feel like you have enough information ahead of you so that you can make an informed decision. I'm not trying to pressure you into anything, and I'm happy to answer any questions that you have. But yes, like I said, I do like to bring things to you fully baked, and if there's anything I feel like is missing or, you know, things that you might want to consider, I will absolutely point them out to you, and then we can have a full discussion.
Question, are the medical cannabis rules for MDs the same as DPM?
I think so.
Yes, they're the same, but I just want to look it up real quick to make sure that it references
I thought we
both.
weren't included at the first draft of those rules. Are we now included? And so does that apply exactly to us now?
I'm 99% certain it does apply to.
Yes, because when we made
DPMs.
the separation, that was one of the things that we got put in.
Okay, good.
Yeah, so you're titled in the Health and Safety Code as attending physician as well.
Well, we're just talking about the Business and Professions Code right now, and that has a separate provision for physicians and surgeons and podiatrists. So the Article 22, oh, sorry, it's 25. I have a 2017 version. I'm looking at section 2525.
What is it, 2525?
Yeah, and 2525.2, I'm not seeing,
I don't think it would be in there yet.
Oh.
The 2019.
This is 2019, but I also have my 2019 here. Hang on. 2529?
2525.
Because I may have marked it in this one, because this is what I use.
And if the original only references MDs and DOs, we should change that now.
I didn't mark it, but yeah, versions.
The only thing we would be able to do now is remove Article 25, because we're not changing legislation. We're trying to promulgate the regulations that are required following enactment of 2138.
Yeah. Yeah, you guys are in there.
Yeah,
Mm-hmm.
we've confirmed podiatric
Yes.
medical doctors are subject to Article 25, the medical cannabis laws. Separately, podiatrists are subject to the California Uniforms Controlled Substances Act. That's what's under the Health and Safety Code.
So for clarification, all the articles that are listed here are all the ones that you are already enforcing. So there's nothing new here. The only thing new is that this reg basically implements what is required by the bill. So, or by the bill that was signed into law.
Yeah, my look at it is I can't think of any other articles that need to be added than these three. I think we're fine. Like I said, we'll do another sweep if we go forward with this. Once I get the authority, I'll be working with Ileana, and we'll definitely tighten everything up on this. And so if there's something left out, I can, definitely inform the board. But I think I'm pretty comfortable with these three articles on this section, on this regulation code.
And as a board member, that's what I would expect. To hear what you're saying is that was an internal question to the three of you to make sure that when you came here, you were confident that you were advising us properly. I hear you say that amongst the three of you to advise us, because that's your duty to us as board members, because this is expertise that you have that we don't. You're comfortable that those articles are what needed to be, and you don't feel that we personally have to be responsible for wondering if there's any other articles in that great big book that we should include, that this is your recommendation to us.
Right, and frankly,
And that's your job, your duty to this board.
Well, and the thing is too, I mean, the more I get to know you as a board and as individuals, I'll have a better awareness of how in depth and how specific your references are amongst each other. Because I have other clients and they talk about article whatever and they know exactly what they're, you know what I mean? So it's part of me is just the learning curve and getting to know my board members and getting to know the board and how I can most effectively communicate to you, because that is my goal. I'm not trying to hide the ball or waste anybody's time. So
Thank you.
I'd also like to point out that although we've got 3 specific articles listed here, this provision also provides for a violation of other state or federal laws governing the practice of podiatric medicine. So arguably that additional language covers everything we need.
Motion to approve Article 1399.659.1 as proposed with the correction of certificate from license on Section B, line item 3.
Second.
Okay.
Christina Dixon.
Okay, okay. Any
public
discussion or public comment? Okay, ready to take a vote on that?
Dr. Manzi?
Aye.
Ms. Elliott?
Aye.
Ms. Cardenas?
Aye.
Ms. Dixon?
Aye.
Dr. McAloon?
Aye.
Dr. Mansdorf?
Aye.
Dr. Zapp?
Aye.
Okay. Now we're going to move on to the next section, which was the substantial relationship criteria.
yes. No, actually, this one is the criteria for rehabilitation.
Oh, okay.
Dr. Mansdorf, when you read did you read the motion off of here?
I did.
Oh, did you? I'm
I
sorry.
read the first one.
Oh, okay. So basically, we would like to include the delegation to authorize the executive officer to make any non-substantive changes and set the matter for hearing.
I can amend the motion.
Yes, please.
Would you like me to read it specifically?
You can,
Or-
but you don't have
Or
to.
actually, so we'll amend the motion to, let's see where,
Authorize the executive officer.
all right. So amend the motion to authorize the executive officer to make any non-substantive changes to the rulemaking package and set the matter for hearing.
Thank you.
I will take your vote again. Okay.
We need a
I second.
Okay. We'll take a vote now with that amendment.
Dr. Manzi?
Aye.
Ms. Elliott?
Aye.
Ms. Cardenas?
Aye.
Ms. Dixon?
Aye.
Dr. McAloon?
Aye.
Dr. Mansdorf?
Aye.
Dr. Zapp?
Okay, great. Now we'll go to the 1399.659.2, which is the criteria for rehabilitation.
Yes, and this one is, it's not that it's more complex, but you have 2 options. So let me just explain to you what the difference between the 2 options is, and then we'll go through what the reg actually says. So option 1, it allows the board to consider rehab on a case-by-case basis. It gives you a little bit more discretion, or a lot more discretion. Option 2 basically says that it requires the board to find rehabilitation if certain criteria are met. So basically, you look at 1, 2, 3, whatever your criteria are, and then you stop. You don't have any more discretion after that to decide whether or not, if you want to balance out some items and say, well, under these circumstances, we think that we need to look at some more things. But if you go with option 2, it's 1, 2, 3, have you done this? Check. Have you done this? Check. Have you done this? Check. Boom, you're done. You're rehabbed. So that's the difference in a nutshell, in layman's terms, between option 1 and option 2. Option 1 gives you a little bit more wiggle room on going, well, you may have checked off all these boxes, but we're still kind of not feeling great about this. That's where option 1 comes in. So that's the the differences. And basically, 1, obviously, a little bit more staff time would be needed. However, Brian, and I'll have him confirm this, but based on my conversation with you the other day, And he had spoken with the budget analyst, and he thought that these were absorbable costs. So if you would like more information as to what that actually looks like, I'm just reporting the general gist of that.
So under the criteria of this new regulation, we don't know what the variables would be because we have no measurement of it, right? We believe that it would be an extra step in the licensing position to retrieve some documentation and input it somehow, some way. We just don't know what that looks like yet. So I don't think there's going to be that much of a cost to it. It's just probably an increase of maybe, we thought, 4% of time. But we don't know how many of these we're going to get. We just don't know. We don't have a measurable yet.
I just wanted to drill down a little bit more on option 1 and option 2. Option 2 would require the board to find rehabilitation when criminal probation has been successfully completed by either the applicant or the licensee. So that's as soon as the board would get documentation of successful criminal probation completion, that's the end of the road and the person is rehabilitated. Option 1, on the other hand, is successful completion of criminal probation, and which would allow the board to consider 5 additional criteria. And for some crimes, it may be necessary for the board to have some additional information as to whether or not the applicant or licensee has actually been rehabilitated. We've also found there are courts that say using successful completion of criminal probation is not very determinative as to how well someone will practice in their profession. That's because with the criminal probation, you're under, the individual is under the watchful eye of the court. They may have to go to jail if they don't complete their probation, and they're also monitored by a probation officer. On the other hand, if we're talking about professional licensure, them having completed their criminal probation under the watchful eye of the court doesn't really help the board understand whether or not they're safe to be around patients at this point. We would say that we probably have a preference for option 1, and it just gives the board the flexibility to ask the applicant or the licensee for additional information to prove their rehabilitation on top of the successful completion of probation.
I'll make a motion to we accept S1399.659.2, option 1, with the wording that you proposed earlier, and changing the word certificate to license where it appears in the section.
Or license to certificate? Is that?
Yeah. Mm-hmm.
Yeah, license to certificate.
To certificate, yes. So, is this language the one for option 1 that you gave me?
Yes.
Okay, great. Okay, so we have a motion to approve the proposed regulatory amendment to section 1399.659.2, option 1, of Title 16 of the California Code of Regulations, criteria for rehabilitation. Direct staff to submit the proposed text to the Director of the Department of Consumer Affairs and the Business Consumer Services and Housing Agencies for review, and if no adverse comments are received, authorize the Executive Officer to make any non-substantive changes to the rulemaking package and set the matter for hearing.
And changing the word certificate or certificates to license.
Yes.
No,
And
it
that
says
was Dr.
certificate, too.
Zapp's motion, yes.
And to change the,
It says certificates here, so you
Okay.
change it to license.
So it was,
No.
It needs to say certificate.
it needs to say certificate instead of
license, so we'll change that.
The nature and duties of a person. Okay. Okay, we have a motion. Do I have a second on this motion?
Second, McAloon.
Great. Okay, let's take a vote. Oh, discussion or comments from the public? I always forget that part. Okay, if there is none, then let's take a vote on this.
Dr. Manzi,
Aye.
Miss Elliott,
Aye.
Miss Cadenas,
Aye.
Miss Dixon,
Aye.
Dr. McAloon,
Aye.
Dr. Mansdorf,
Aye.
Dr. Zapp.
Aye.
Great. Okay, so this last one should be kind of easier.
This one should be kind of easier, and this one is
The name
in
change.
response to, to your name change, or the name change of the board. So basically, there's two ways you can do this. You can do it with the way that was presented to you in your board meeting materials, which basically strikes out from every single reg under the title where it says Division 13.9, strike Board of, anyway, basically strike out the language and add new language so that the current name is the accurate name as of
Right.
July 1st.
So from Board of Podiatric Medicine to Podiatric Medical Board.
Yes. Or, yeah, Podiatric Medical Board of California, yes. And there are provisions within all of these regulations that refer to the Board of Podiatric Medicine. We can either go in and change all of those, which is very easily done, and we can just amend the motion to reflect that. But there's also a provision in the bill that changed your name that says any reference to Board of Podiatric Medicine will mean Podiatric Medical Board of California. So we can make it really clean and pretty and change all the internal regs where there's a reference to BPM and change it to
PNBC.
PNBC. And we can change that. And that is very easily done, and we don't have to do anything extra other than amend the motion to say, change that.
Great.
And this is this
So-
is a quick,
Just to bring you up to
Right.
speed, you understand, we're just trying to be in line with the Medical Board of California. So we're the Podiatric Medical Board of California. Yes.
And that decision's already been made anyway. This is just to fix the document, correct?
Exactly.
Yeah.
Fair enough.
yes, and it's basically just to clean up, and if you're gonna have regs with your new name, wouldn't it be nice that your regs actually show your
Well, I
your
think
new
it
name?
needs to. We have a sunset review coming up. and
Yeah.
It needs to
Yeah,
be
this is part of what's gonna come up next in public education, the implementation plan of the name change, and this is one of the steps, is to this is one thing we could start now and submit and get done by July 1st.
Neil.
How about if there are some issues with the articles as printed that need correction?
Can you tell me which ones?
Okay.
Or give me at least an example, and I will look at it, because,
Well, actually, there's
yeah.
quite a few.
Oh, okay.
So
Just give me the first one then.
page 62 included in the board packet, or 66 on the external packet,
Or what's the reg number?
1399.656.
Okay, thank you.
Excuse me, it would be 655,
Okay,
where it says in the middle of a paragraph, it says Medical Board of California. Shouldn't it say Podiatric Medical Board of California?
yes, we will change that.
No, wait, is that meaning the Medical Board of California?
Pardon?
No, we don't want the executive director of the Medical Board of California.
And we'll change it to EO instead of, AEO, yeah.
That's an instant pay raise.
Yeah.
Yes, we
You
will
know,
make those
This is
changes.
section 100, and I don't know that this will fly with the section 100.
Well, that one may not.
I mean, if we made it now, I wouldn't be able to section 100 is so easy. I just put it in, they make the change, non-substantive. We did see, Dr. Mansdorf, we did see this and some other things, but I didn't want to confuse the things as I went through with just the name change. So if I could just keep the name change alone, and we can make a list for next year, or sooner than next year, to clean up these regs. There's other references to when
I
we
think
were
that would-
separated out.
I would be happy to help you with that, and we can have that ready. I don't know if at the June meeting, but this year, we can fix that.
Okay,
And
'cause there are a few.
Yeah, and we will do that. Because, yeah, it is beyond a section 100. I thought there was a reference that we could easily fix, but now that I see that this isn't the case, yes, we will take care of that, and it's an easy reg package, so.
You know, I brought this up to Brian because I think when we separated now, it would be DCA that would appoint and not the medical board in the past. So that's a big one. That really does have to be changed, but to mix it in with the section 100, I think it would stop the whole thing.
So a Section 100 change can be made. Well, basically the reg process is different, and I know that you probably know this, but maybe Dr. McAloon isn't familiar with the process yet. So basically, doing regs is a very time-consuming process. It's quite arduous, and when you have a Section 100, it refers to one of the regulations for the Office of Administrative Law that approves the regulations when they get changed or when they get added or deleted or anything. So a Section 100 allows you to very quickly and very easily quickly by comparison, quickly and easily make a non-substantive change, or something that basically, like for instance, your name change doesn't really change anything other than the statute was changed and therefore it changed BPM to PMBC. Okay, fine. So we're going to do that, and we can do it with a Section 100. And now that the reg process for boards requires it to go up the chain, it goes through all the DCA, the director has to approve it, and then it goes up to the Business Consumer Protection Services and Housing Agency. It's a really long process. You can skip that. And so it shortens the timeline quite a bit when you can just cut out those pieces. So because we can only do non-substantive changes in this, that's why those other things aren't being addressed. But, I'm sorry?
There's a lot of them. I mean, even on the next page, we're going to, the board recognizes the respective corresponding sections of examination, the United States Medical Licensing,
right,
and the National Board of Osteopathic Medical Examiners, and the,
So what, so I guess there's two things here. First, it's absolutely, yes, the board needs to change the name in the regs, but the board also needs to make these other changes. The board would have to make those other changes regardless. We just have to put it on the list of regs to do. So if, I can work with Kathleen
I would like
to
to
expedite this, but
You have those right in front of you, and they're so beautifully printed out and easy to read. If anyone sees any other updates, we'll
I
get it
will
done.
take care of it, yeah. And when this comes up at a future board meeting, all those other changes will be addressed as a cleanup package. But it'll be more than a Section 100.
So I believe the suggestion is go ahead and approve the Section 100 for the name change, and then we'll work on cleaning up what we call a sweep of the regs and cleaning that up, and we'll submit that. So the Section 100 is a really quick and simple way. At least we'll get that accomplished, and won't bind while we do the regulatory cleanup. Is that it?
I just want to add that there are some minor technical revisions that need to be made to some of these, because I'm looking at page 61, the first page of these. It's 1399.650 citation. The authority and reference sections are for the medical board. That should be changed to section 2470. And this might be problematic, trying to get these through OAL based upon the medical board's statutes and provisions for promulgating regulations versus the podiatric medical boards.
Can I make a suggestion? So I would like to propose that I bring back to you at the next meeting a combination, like basically fixing all of this. All the Section 100s that we can do, it'll be perfect. You guys will look at it, hopefully you will approve it, and then we can go through with the Section 100. And then we'll add to the list of regs to be done one that actually reflects removal of the medical board and osteopathic medical board from the regs, and whatever other substantive changes that need to be made that can't be done through a Section 100 as a part of your name change and separation from the medical board.
I think that's a great suggestion, because what I'm hearing from the board is that what we don't want is to, kind of gloss over the fact that there are other changes that need to be made.
Oh, and that's absolutely recognized, of course. Yes, and the intention of this was just to kind of do a quick, with our name change so we can get it in effect as soon as possible, at least the regs will have the right name on them. And those can be done easily. The other ones will be a little bit more work, but still not too much.
Okay. So we're at section 100 BPM to the Board of Podiatric Medicine to the Podiatric Medical Board of California name change.
Yes, and I will bring back to you at the June meeting, whatever your next meeting is, so that you will have a complete Section 100 package to approve then. So right now, you're going to just direct me to fix all the Section 100 issues in these regs and bring it back to you at the June meeting.
Okay, so does someone have a motion for that?
I have a motion.
You don't, but
I don't
It's-
need a motion.
That'll
no,
be
but
the,
I'm,
so we're
you
just
know,
not gonna.
I'd rather be safe than sorry. I'm never going to turn down a motion.
No, it's fine. Okay, so we are gonna direct you to, bring us a Section 100 completely package.
Yep.
Update.
I'll bring it to you at the June meeting. You'll be good.
I just want to clarify, some of those might be more than Section 100, so.
No, I'm just the Section 100s, and then,
She's doing an overview.
Okay.
She's gonna show you what's Section 100 and what's
Okay.
more substantive.
and we're going to split it up into 2 reg packages. And we'll get the
Right.
Section 100 done just to get it done.
But just to reassure everyone, when we were separated out, there was language added that said, if any of this changes anything, refer back to how we were. So if somebody thinks we don't have authority to do something because we were separated out, we did have section in that law that did say it won't affect the
Yes,
substance.
and that's true.
So
It's just
there's a lot of these.
just add
I
it to
mean,
the
this
list
is
of
like a
things we need to
full-time
do,
job.
but
If you
yes.
want, and that's for everyone's regs. There's been legislation for the last 6 years or something, to try to
They
get all
should
the
give us all an
agencies-
extension or a sunset review then.
We'll have it done by
Okay.
then. We'll have it in process for sure.
Do we have any more things to say about this legislative program while we're on it? Okay. I do have one thing I would like to ask about. I know that there's an AB 890, and that's the expands the scope of practice for qualified nurse practitioners. And I would just be curious as to know what kind of expansion they're looking for. And it's not important to get right now, but I just would be interested to know. Anytime there's an expansion in either nurse practitioners or even physician assistants.
Okay.
Okay. All right. Okay, so now we're going to go on to.
We don't need a motion for this.
No,
It's
just
a
sort of
dir- it's a direction.
I'd like information maybe at the next board meeting.
But did we vote on the 100, this?
We're not voting
Not
on
gonna
it.
vote on it.
No, I'm bringing back something in June for them to see all the Section 100 changes, and they're going to hopefully review and hopefully approve those. We'll do a Section 100 reg package, and then I will also bring back, well, I don't know if I can do this by the next meeting, but it'll be on my list for whatever your next meeting after the June meeting is, to identify all the things in the regs that need to be changed to conform with the new independence of podiatry, I guess.
But I just want to clarify, this Section 100 change will delay then? And
Yes,
Because it's,
yes,
okay.
it's going to be held off one more meeting.
Okay, actually, maybe this might be a time, no, we'll do it after new discussion. Okay, let's go to public education now. We're gonna get an update and possible action. Darlene? Julia? Okay, let's do it.
Okay, so for the recommendation for public education program report, so we're just going to discuss and maybe possible action regarding the board's outreach activities regarding matters before the board, including board's change in title and the newsletter. And I think we had some items we wanted to also add to our public education out of this meeting. The issues at hand are the discussion and possible action of implementation plan for name change to Podiatric Medical Board of California. This process will conclude by July 1st, 2019. In the packet, you will see a timeline of all the activities that need to take place. I don't know if anybody has had a time to review. This is quite a big effort for staff and a staff so small for our little organization.
I just want to say my appreciation for putting this timeline together. I know how time-consuming it is to put thought process into a spreadsheet, so thank you for that.
And then I have a question I know on the budget, there's a line item for, I think we have funding set aside for consultants or temporary staff. So is there a need to maybe consider bringing on a temporary staff to help with this effort?
That's a difficult process. We do have a temporary position We would have to go through the HR process. By the time we probably got that approved, this would be done.
But I guess then the question becomes, how realistic is this timeline?
Realistic. I think we've all penciled, we all worked on this, and this is something I think we can, it's a lot of internal stuff that needs to be done anyways. So, the only thing that we're going up against is the sunset review report, and we're expecting that to come in April, May, or something like that. But we're already ahead of that curve because we're already set, ready to go for that. So I think we'll be okay. But I can look into the temporary help. We do have a .2 position that we have $24,000, but it's just getting a duty statement and getting it charged. Maybe we can expedite that.
What about interns? Do we tap into the interns? Is that a process as well?
Yeah, it is. It's all a process.
Okay.
So if we didn't have it already set up, to set it up, I mean, sometimes doing the work on that when we can concentrate on, the work itself.
Okay. Thank you. So does anybody else have a chance to review the timeline? Is there any comments?
So then by the June board meeting, you would have hopefully met most of the milestones. So will an update be provided then on the status?
And it will be nice too in July if board members and other stakeholders will use the website, make sure we've got it right.
I have a question about the website, though. It seems, do we have control of our own website, or don't
Yes,
we?
we have the control of most of the content.
So how about, you can instantly do an update tomorrow on the website of, say, our pictures, our bios,
take a
all that.
week.
It doesn't have to go through anybody else.
Well,
No, it doesn't. We have to submit it to OIS with a ticket. So we don't have complete control of our website, meaning we don't have an IT person staffed. So it has to be through that filter, and then it's prioritized.
So when you say that, that means we could be changing our update, we could be updating our website daily, and in fact, the changes wouldn't be reflected for months?
Sometimes weeks. It just depends on the priority of it.
I know it's very important, OIS, that we say publicly. It could be sometimes extensive, but it's usually not more than a week. And if it's an urgent matter, they will prioritize it.
They're
But-
pretty good about doing that.
Yeah, but
they're
with
really
your-
good about accommodating us. So, we're not like the medical boards where they have their own IT staff, and the director walks over there and say, "I want this put up right now," and boom, there it is.
And I'd just like to state, if anybody would like to update their bio, this would be a good time.
And I think there should be a deadline to that. I think everyone needs to look at their bios, update it, and if you want a different whatever send it within a week. Because I really think I just think there's a huge lag in our website.
Okay.
And I'm not blaming you for it, I'm just saying that because of the way it has to go, get in line or whatever.
And are you responsible for being the point person for taking the bios and all of
Yes.
that? Okay.
I do want to point out one thing from a legal perspective. It looks like item number 3.2 on the timeline, identify docs needing to be updated, changed on website, and also, section 1. 1.2 regulatory, we've discussed this just now, so we're on track with that one. The printed materials and possibly other signage/logos, those things, those need legal review, and because I've never seen, well, not never, I haven't really spent a whole lot of time looking at all the forms that you have and, the status, how much work needs to be done on them, whether it's really quick or kind of time consuming. I don't know that I can commit to the timeline that's on here. So I just wanted to point that out. I don't know if you want to change the dates or just be aware that this, from my perspective, is a little tight for me. So I will do it as soon as I can, but I have to, obviously prioritize my other clients too. So I need to,
So you're talking about the name change, basically?
She's saying any document, so any.
Right, so if you look at 1.4 on the timeline, where it says printed materials, and if you also look at 3.2, which is identify docs needing to be updated, we can identify the documents. I don't know, it's, to do a thorough legal review of documents, I have to look all over the place to see that all the requirements are being met and that there's nothing on there that shouldn't be on there, that the law hasn't changed. And that takes some time, and especially depending on how many documents that I would be reviewing. And because I don't know that yet, I can't give you a timeline. But I can tell you that that's this month. I don't think that's going to happen. So I'm just letting you know, and let's open the discussion as to when you would like to see that. Because I don't want to tell you when, but I also don't want to tell you that I'm not going to do it by a certain date either. So.
And what I'm hearing from everybody, I think, we're all concerned about making sure this timeline dates are going to hit, and we know things shift. So for me, I would like to see, even though we're not meeting until June, if we could maybe get a monthly update of when this timeline is being changed or updated, or something's being put on hold for any reason.
I'll work with Brian on my end of the
I'll just
timeline.
include it in my monthly update to you. This will just be a section of it, and you can see the progression.
And if there's any other discussions or recommendations?
Do we need to take a vote on this, or is this just informational?
I believe it's
Yeah, I mean, just
gold.
from an informational perspective, I think your insight and comments regarding things related to you are very helpful, because we wouldn't want to put you in a position where you can't meet a deadline, because that's completely
Right.
unrealistic. So we trust that you and Brian will work together and make sure that it's realistic, and that the updates monthly are sufficient.
Okay, sounds good.
I just want to state one thing because I've been going through all these documents, and they're all on our G drive in Word, and then we turn them into PDFs. I mean, we're just doing a global change of the name. If there's something that's not updated with the current law, it's up there right now. Anyone can look at it, because we're not going to substantively change these documents. We're just changing the name throughout all the documents. So whatever content exists, and I mean, of course, if we see something wrong,
But then the question too about content, because I was on the website, and there's limited content on the website right now. So is there an archive section where you can go and get information that's older than what's being reflected?
all of the board minutes and actions of the board, and when we have published the committee meetings, are all archived. But as far as documents, they're kept current, so the old one would be gone and the new one would replace it.
Well, I'm referencing the fact that even though there may not be a lot of documents on the website, it's possible and probably likely that you have a lot of forms or documents in hard copy in your physical office that I would need to look at.
Then I'm also concerned that we're using older forms. So is this also an opportunity to look at forms to see if there are areas that need to be expanded or additional categories added?
I would be willing to, again, I'd have to figure out to look at my calendar, see what I can do. But I think that's a good idea. There's always room for improvement, and there's always an opportunity to find out if the old forms need to be updated. At the very best, I can provide you with an update at the next meeting as to what this really looks like, what the damage is or isn't, what needs to be done, how long do I think it's going to take, and kind of where we are.
Just wanted to mention that a couple years ago, we did a complete website redesign under the prior EO, and all of the forms were updated at that time, so they should be fairly current.
Oh, that's good. Thank you.
Were those forms like applications, any other requests for information from licensees or applicants? Were the forms approved by legal?
I do not know. It was under another staff member in the prior EO that made all those changes, and they were put on the website. Other staff was kind of kept out of the loop with that.
Yeah.
at
So
that time,
I think all we're saying is, I haven't seen any documents or reviewed them for legal concerns.
So start fresh.
Yeah.
Yeah, so
It's a
I'll
good
look at
time to do
everything
it.
and I'll just give you an update as to what realistically this looks like from a legal perspective, and we'll have a better idea of where we're at in June.
And then
May I just, I'm sorry, if I may. I think that there's two lines of discussion right now that are being merged. One is the simple update of the name when the change happens, and the other is a review, including legal, of the forms and documents available to the public and in use by the board. So I just don't want to block one for the other.
And
And I
I don't-
appreciate the
I
review
don't see
being
that's a problem
offered.
at all.
No, I don't either. I recognize the effort and commitment to review the forms. I think as a board, for when we do look at the name change and the timeline that's being proposed from the Public Education Subcommittee, it really is, it almost reads like an internal document to look at what's going on in relation solely to the name change. And it might be needed to do an action timeline in terms of a legal review. And maybe we can look at that when we meet in June.
I
But
agree.
I just wanted to have that kind of clarity of what we're really discussing.
I think we're on the same page.
And I was going to echo that sentiment because I think this is a timeline specifically related to the website, right? But what I've been asking for is a timeline specifically related to changing from the current board status to a standalone board.
Well, the first section and the notification, I mean, I see it as two sections. One is the website, and one is the third-party notification to get it to everybody, the notice of the name change. So,
But I think
it's
to
really two
Maria's
parts.
point, the more substantive work is
Mhm.
thinking about us as a board being now a standalone board, which, I mean, you may have everything covered here, but there may be other things that we should be looking at
Yes.
from the perspective of we're now a standalone board. What things need to be modified, modernized, improved, enhanced.
yes.
But you don't want to not have your website up and live because we're combining the two.
Mm-hmm. Yes, I see.
Again, I think it's, the timeline is what it is, and we're gonna be adjusting, but also, as we find things, that we need to make sure that we're, have some type of mechanism, that we're bringing it back to the board, and we're understanding what needs to be updated, so that we don't, this is a clean slate for us, so that we can start fresh with everything matching.
I want to bring up one other logistic. Someone said, are these like the application forms or something? Well, when it comes to Breeze forms, then we're under an entirely different timeline for Breeze forms. And they do their uploads for, a lot of money, a couple times a year. You're either part of it or you wait till the next 6 weeks. So Andrea's been on that, and she's been making changes to the forms, mostly because we had some fee changes, and those all had to be made. So, but we're aware that Breeze could slow a lot down if it's a Breeze form.
Alrighty, any other discussion before we move on? Nope, okay. So the other topic is our footnotes, discussion of topics for future newsletter. I believe Kathleen is working on spring and summer right now. And again, we need to give ideas, especially right now with staff being overwhelmed with all the duties that we have been giving at this meeting. If there's any ideas for the newsletter, or if anybody is interested in writing an article.
I have a topic. 3 weeks ago, I had the privilege to go to Philadelphia to the National Board of Podiatric Examiners meeting where they're discussing a test that I didn't know that we had. And most of us know that there's a Part 1 test that our students take in their second year of medical school. And there's a Part 2 in their fourth year of medical school, and a Part 3 in their residency. But hardly anybody knows that there is a Part 2 clinical exam that every student has to trek to Philadelphia to go to where it's held at the National Board of Osteopathic Examiners building in Philadelphia, and they're presented with a case of 15 simulated patients in 15 exam rooms, and they go to each one and they have 15 minutes to interview them, come up with a diagnosis, and write a reasonable note on that encounter. It's being videotaped and evaluated, both their knowledge and their skill level, and whether they're presentable, whether they can actually talk to a patient in English and make sense of it, or whatever language is appropriate, but make sense of what the encounter. So it's almost $2,000 to take the exam, plus the expenses to go to Philadelphia. So all the osteopathic students in their fourth year go to either Chicago or Philadelphia. I think the medical students might do the same, but I didn't realize that the podiatry students have to do this.
Yeah, they do.
And I've talked to several podiatrists, including people that are that are in residency programs, and they didn't know this test existed. So I think it'd be a great article to let everybody know about this clinical skills exam that all of our. And I think this is one of the reasons why we see fewer violations in the future. The training these young people are getting is just amazing, and they're really being graded on their ability to do a complete history and physical, and all the podiatric diagnoses, and their clinical rapport with patients.
Yeah, and just to comment on that, I think that was like the whole pathway to parity, because the MDs do have to do it, and so don't the DOs. And so I think it's a great idea, because I think to actually, especially the videotaping piece and the piece of someone actually watching, who is this person and can he interact with the patient? And so, I mean, I just think it just mirrors the education that of the general medical community.
Sounds like a great article.
Yeah, it would be.
Thank you.
So, Mike, you can write that.
I'll interview somebody.
Darlene would really appreciate
I
that.
would really appreciate it.
Just volunteer.
Excellent.
So I have a couple suggestions. I think it would be, and I don't want to volunteer the board members, but I think it would be beneficial to maybe highlight the board members and maybe things that they're working on or their interest in being on the board. Because, you know, this is public service, and we're here because we care about being public servants and the profession. So I think that would be something beneficial. And maybe you rotate it so that you're not always looking for an article. It's like maybe this month you highlight the new board member, or you highlight Judy because she's a new president. So I think there's opportunities to highlight what's going on in the profession and even the public members' interest in being a part of this board to give you ongoing content. And then I would also suggest including some context around legislation. We heard about this Medi-Cal legislation that can expand the opportunity for individuals who are lower income to receive the care that they need. So especially from me as a woman of color, knowing that people of color are often impacted by diabetes and amputations at a higher degree than others, I think having that information out to the public is really important, and it gives them something to advocate for with their members, because that's how laws get passed, right? People advocate on behalf of themselves. And then just from, you know, a perspective of visual, I really do want the board to be very mindful of the visuals and the pictures that are being used, and making sure that they are comprehensive and diverse.
Thank you.
Yes. So, what I'm hearing, we have a lot to do on the footnotes. And so for me, and the committee, I think working on the footnotes, maybe that we have a running list of topics and that we can flush through at our subcommittee meeting, and at least get them in the queue.
Okay.
And I believe, if I'm not mistaken, you have your assembly member?
Yes, Assemblymember Jose Medina has agreed to do an article since we'll be at UCR, and he is a big component of the funding for the UCR Medical School. So he's very excited. Yes, he's very excited to do that for us.
Sounds like we have some good content this time.
Yes.
Okay. So,
Alrighty, moving on.
okay, so if anyone else wants to bring up any discussion of topics for future newsletter, this would be the time to do it. All right, great. So the next is the quarterly budget. We've kind of gone over a lot of budget today.
So this is basically, we went through the budget, right?
Right.
This is just the board giving me the authority to entertain a fee study, or to seek a fee study as we're coming up to the sunset. So the board needs to approve me to go find somebody to do this fee study.
So I make a motion to direct the executive officer to conduct a fee study.
I second.
Is there any discussion? Okay, public comment. All right, then we have a motion for the executive director to undergo a fee study.
All right. Dr. Manzi,
Aye.
Miss Elliott,
Aye.
Miss Cadenas,
Aye.
Miss Dixon,
Aye.
Dr. McAloon,
Aye.
Dr. Mansdorf,
Aye.
Dr. Zack.
Aye.
Okay.
Dr. Manzi, you're getting pretty good at these motions now.
Thank you. Yeah, I only have to do this 3 more times. Okay, executive management, that's me.
Thank you.
So, There was a discussion and a possible action regarding the Sports Medicine Licensure Clarity Act. And that, basically, if you could turn to, do we have it on here? Yeah, it is, okay.
Last tab.
Last tab. So, the way I understand this is, you know, if you have a sports team that you're, we're going to discuss this for a minute. So if you have a sports team that maybe is traveling from out of state and they bring a trainer with a podiatrist with them, or if you're a podiatrist who is licensed in the state of California and you travel with the sport team out of state, it's basically, you know, your ability to provide that care and be your professional liability insurance coverage would or would not come into play. So that's what this is about. So actually, Dr. Zach brought this to my attention and felt that maybe we should look into this. And I don't know if you've had a chance to read this and what it means, but it's like the coverage of the medical service would mean that the general medical care, the emergency medical care, the athletic training, such terms does not include care provided by a covered sports medicine professional, like at a health facility or. So the term covered sports medicine professional means a physician, athletic trainer, or other health care professional who is licensed to practice in the primary state. And it provides coverage of medical services pursuant to the written agreement with the athlete. The only way I thought this was a little confusing to me was if indeed the scope of practice was different in the state in which they are licensed in from ours. Right, that was the only conflict I
If
saw.
they don't have an ankle license in their home state and they come here and all of a sudden they can do something here they couldn't do back home is not.
Right,
Is
or
there
vice versa. Say you have an ankle certificate and you go and start treating an ankle in Louisiana or something. I don't know.
Right, and for whatever reason that law doesn't allow it. Yeah, so basically, it's like the lowest common denominator is what you can do in both states.
Okay. Well,
That's the shortest way to describe it. And also, the primary and the secondary state, so obviously primary state would be if you're a podiatrist licensed in California and you go to Louisiana, I don't know. They have to have substantially similar licensing requirements. So that means that whoever's doing the insurance and whoever's making a claim is going to have to know if the licensing rules of the state that they're going to. And I feel bad for those practitioners who have to do that, and hopefully that they're okay. I really don't know anything about what the licensing requirements are for other states, so I don't know how this would impact the licensees. But in terms of the scope of practice, it's basically what can you do in both states legally is what you're allowed to do in the other state.
So it basically limits more a person who has a bigger scope of practice.
Yeah, so say one state has a bigger scope of practice and they go to a smaller state or another state where they have a smaller scope of practice, that person who normally would be able to do X, Y, and Z can now only do X.
And does their malpractice insurance follow them?
What do you mean by does it follow them?
Well, in other words, you know.
Would they be covered in another state?
Right.
That's what it sounds like to me, is that, yeah.
So we have a requirement for a 2-year residency in California. Some of these people may not have any residency at all, might be practicing for a long time.
Mm-hmm.
Do we care about that their training level is significantly different than what we require in California?
Well, so this law is really just about professional liability insurance and when you're covered and when you're not. It doesn't have anything in here about reciprocity between states, and I did some looking and I wasn't able to find anything for reciprocity with regard to movement of doctors between states and when you get an out-of-state license. Accountants, for example, they have a very explicit reciprocity situation going on in their statute. You guys don't seem to have that. So the only thing that legally allows another licensee to practice podiatry in the state of California without a California license is in the state of an emergency. And that's under the Business and Professions Code. I don't know what it is if a California podiatrist were to go to New York And, outside of an emergency, I don't even know if there's an emergency provision in New York law, but you would have to use the law of the state where you're doing the work.
So I have a question for clarity. So this has nothing to do with licensure. This was just making sure that these people have their
Yes.
malpractice insurance. So this is directed to malpractice carriers, not to
Yes.
state boards.
Yeah, I can see why he brought it up, because it definitely is of interest to
Yeah.
the licensing population.
And,
It
yeah,
definitely
the
warranted
consumer.
some conversation.
Yeah.
And it asked good questions, yeah.
So when someone from out of state comes here, say for a football game, they're not required to register here. They come with the team.
That
The team
part,
doctor.
that part of the law, there was a provision, or there were at least one or two provisions in the Business and Professions Code that address that. I forget what it was called, but it was basically Section 901 of the Business and Professions Code. That's now gone. And that was basically when you have people coming in from out of state to work at fairs or whatever, I don't know. And they would have to register and go through this whole process, but that doesn't exist anymore. So,
Do I interpret it correctly, though, that it pretty much only encompasses the event or anything outside of a facility or hospital? They're not rendering
Okay.
treatment, right?
right. Yeah,
'Cause
that's
this says
correct.
not included.
Out of the event, I honestly, I didn't really, yes, I have to look, hang on, because I don't remember. I was focused on what are the substantially similar, I was looking at things that actually would apply to you guys. I can look at it and tell you offline, but right now I don't know.
All right, and then an update on the implementation of the board's strategic plan.
Okay, so I just want to give you an update on that. We contacted Solid, or I contacted Solid, and we're going to do the action plan. And we are all going to go to Solid on March 18th. That's the staff, not you guys. And we're going to work on meeting the goals of the strategic plan. So once we have that training, and we'll have a live document, I'll be bringing that to the executive committee and updating the board. So you're in tune that we are meeting our strategic goals.
So I have a question about that. In my experience, one of the best ways to ensure that the strategic plan stays in the forefront and is constantly being worked towards is to have it incorporated in the agenda.
I agree.
So will that be a part of the agendas moving forward?
Yes.
Yes, I was just at a meeting that it was actually, it had more to do with the CMA strategic work plan, but they definitely bring it up at every meeting, and then they do a little like theirs for next year's, like leadership development and,
Right, and I think
sensory
it's good for the
focus.
sunset review when that question comes up, how are
Right,
you
and-
achieving your goals?
Exactly.
We will have that, we'll
Right.
have that guidance.
Right, and I think we brought up plenty of things in this meeting that shows some of the things we need for development, like our expert witness development and our whatever.
Right.
Okay. Okay, so, the next thing is, I'd like to, okay, does anybody have any public comment or anything else to add here during our executive management discussion?
I do have a quick, now that we have a new board member, looking at committee assignments again,
That's a good point.
and making sure that she's kind of brought into the fold.
Right, so what I'm thinking is Ms. Dixon's gonna be departing us, and we might put you in her positions. I think, Christina, you're on public education and legislation?
That is correct.
Okay,
Okay.
so we'll get you in, we'll get you looped in.
Thank you. Okay, thanks for bringing that up. Then before we adjourn, is there any future agenda items that anyone wants to bring up?
I think there's one thing, do we have to have a motion to accept the executive officer's reports? Yeah.
All right, who would like to make that motion before we,
Motion to accept.
okay, Darlene has a motion to accept the executive officer's report. Do I have a second?
Second.
Okay, can we have a vote?
Zap, aye.
Dr. Manzi?
Aye.
Ms. Elliott?
Aye.
Ms. Cadinas?
Aye.
Ms. Dixon? Aye. Dr. McAloon?
Aye.
Dr. Mansdorf?
Aye.
Dr. Zapp?
Does anyone want to bring up any future agenda items?
I do have kind of a request. I know we've been burdening staff with a lot, but because we only meet quarterly, a lot of things get lost for the next meeting. Is there a way that we can, a lot of the items that we have here, put on an action item list of when they're coming back to our board so that we know if it doesn't fall off and that we don't forget about it until it becomes an emergency?
We can do that.
Okay.
That's great. This isn't necessarily for a future agenda item, it's more of a FYI. Like I say, I sit on a couple boards, and I think some of this is of interest to our board in a way. So, the opioid crisis, of course, is horrible, and so some updates on notable activities of the CMA was this California Death Certificate Project. I don't know if you've heard about that, but anybody who got a death certificate that mentioned opioids as maybe part of it, from 2012 to current, they're now tracing back to who prescribed the opioids. And, podiatrists do prescribe opioids, so it's just something to be aware of, that they are doing that. I thought that was interesting. Also, they brought up something that I, thought was like, wow. And it really doesn't really have much to do with podiatry. I guess it's just more about medicine. But they're now thinking of, there are some people who are having their citizenships blocked if they had already received some government services prior to getting their citizenship. And I thought that was like another, yes, horribly wrong thing. But just, I don't know. That's our country right now. It's pretty crazy. All right. Well, before we adjourn, or should I adjourn? Before I adjourn? Before. Okay. Before we adjourn, this is a kind of a sad thing because Christina is leaving us. She's served us for over 8 years. Over 8 years. She's been everything. The president, the vice president, a couple times. A couple times. She's, I don't know. To me, she was sort of my go-to person. Like, oh my God, how am I ever gonna run a meeting like she does, or bring up the points she does, or And for a person who's not a podiatrist, from a person who is a podiatrist, your sincere interest in not only understanding what this is all about, but just your amazing support of our profession and our board does not go. You're not going lightly here, and we really appreciate it. And I'm going to miss you terribly.
Oh.
We'd like to give you this little certificate of appreciation.
That is very
stand?
sweet. Sure. And of course, I have to take personal privilege and have a comment. But
I wish you would.
With the certificate?
Why not? So please.
Yes. So I
The floor
just
is yours.
want to say that it has been my distinct honor and pleasure to serve on the board. When then Assembly Member and Speaker Karen Bass asked if I wanted to do a board appointment, I said yes. And when they said, well, we have an appointment to a board, it's the Board of Podiatric Medicine, not pediatric. I said, I know, podiatric, yes. And so they looked at me like, well, this is a board that, at that time had a hard time keeping a quorum because no one understood what podiatry meant. And it was, it can be a overwhelming topic, to sit with doctors because you don't really know much about that scope of the process. But I'm very passionate about feet and especially passionate about how the care of feet and wound care can definitely impact communities of color, especially with regards to diabetes. So I definitely took the opportunity to, be able to be that voice and have that diverse, because when I came on the board, I think I was the only person of color. So that was very interesting. But it's definitely been a wonderful experience. I love public service. I encourage people to serve publicly on boards all the time. And not only has it been rewarding for me to get to know the more about the profession, but to also get to know each of the board members. And so I think that's what I'll miss the most. But I do, want to say thank you to staff for all your hard work. I know I'm oftentimes a little tough, but it's only because I care. And I'm very passionate about making sure that the public understands what's going on and what we're talking about, because ultimately they're also a part of who we're protecting. So just want to say thank you. I appreciate the opportunity, and I look forward to seeing you all sometime soon. You may see me. I may be at that legislative day. So I'm gone, but, I'm still around.
Until June 1st. Please come to
Until June 1st.
I have a question, Dr. Manzi. Would it be, I don't know if this is something that's been done before, it might be beneficial, so I'm just throwing it out there. Has the board taken a field trip, for example, gone to the UCSF Limb Salvage Clinic and see that kind of service in action? Because
We
some,
did Kaiser.
Okay.
We did a Kaiser,
Kaiser visit?
and
Okay.
I got them to see our department and how that whole thing works with orthopedics and podiatrists. We had a wound care, we had Dr. Patel talk about, gave us a pretty good slideshow on what, how come you need more podiatrists, but basically. But I think more field trips is a great idea. We did go to the college, and we're gonna go back to, are we going back to Samuel Merritt, or?
We're going to Samuel Merritt.
Yeah, so we've been to one of the colleges.
if there's
But-
interest in going to the UCSF Limb Salvage Clinic, I can make that happen.
We have a board meeting there when you're president.
I don't know if they would give that. I don't think it has room space, but I'd certainly a field trip at the minimum.
Just sharing an idea, I also help support the Veterinary Medical Board, and at their last meeting, they hosted it at UC Davis, and they put the lunchtime hour for their board meeting to do a visit of the UC Davis Veterinary Medical School. So they incorporated, the board meeting and a site visit on the same day. Just an idea.
Yeah, it's a great idea. This crew loves field trips.
Okay.
The more we can learn
They do.
about the profession, absolutely.
Anyways, well, I think I'm gonna adjourn the meeting if there's nothing. So this meeting is officially.
And you got the
Motion to
take a
adjourn.
Motion to adjourn.
Second.
All.
Who made the motion?
Dr.
Mansdorf.
So I have a motion to adjourn and a second. Ready?
Okay, as to the motion to adjourn, Dr. Manzi?
Aye.
Ms. Elliott?
Aye.
Ms. Cadenas?
Aye.
Ms. Dixon?
Aye.
Dr. McAloon? Aye. Dr. Mansdorf?
Aye.
Dr. Zack?
Aye.
Meeting